So, and what we're going to do at this point, we're going to return to the Commonwealth's case. And with that, Commonwealth, call your next witness, please.
Thank you, Your Honor. Commonwealth will call Michael Snyder.
While we're waiting for Dr. Snyder, could we just approach?
Oh, sure, yeah.
Thank you. Apologize.
Okay. I don't know where we're at in the courtroom. I don't know what's going on right now. But also, I can't find the Sarah Grace Patrick trial. Good morning, darlings. Good morning. Good morning. Come on in. Oh my gosh, it's so early for me. It's like so early. These are not a true crime content creators hours, but we are awake. We're going with it. If anybody can find Sarah Grace Patrick's trial, I would rather watch that one. Maybe it's not time yet. I'm starving.
Good morning. These documents are the testimony and the evidence that you shall give to the court and the jury and now finding between the Commonwealth and the defendant. Thank you. You may have a seat, sir.
Watch your step, please.
All right, good morning, Doctor.
Good morning.
All right.
May I inquire?
Attorney Buckingham, please.
Thank you. Good morning, sir.
Why is it so
Could you please tell the
yellow?
jurors your first and last name?
Yep, Michael Snyder,
Do you mind spelling your last name for the record, please?
Snyder.
And how are you employed?
I'm a physician at Beth Israel
Hey,
And
Crystal.
how
Hey,
long have
Mama
you been
Coop.
a physician?
since 1998.
Can you tell us a little bit about your educational background?
So undergrad at UMass Amherst, I did medical school at Tufts University, and then I did my residency in emergency medicine at Boston University.
And how long have you worked at Beth Israel?
Since 2014, 12 years.
And do you primarily work in the emergency department?
Yes,
I'm going to draw your attention to January 24th of the year 2023. Do you recall working in the emergency department on that day?
yes,
And in the evening, were you made aware of multiple
Sorry about
pediatric
that.
traumas that were coming into the emergency department?
yes.
And when you are made aware of people coming in, how does that occur?
So we'll typically get a call on the EMS phone that something's coming in that they want us to know about up front.
It's hard
And
for
do
me
they
to have
provide you
one
with some basic background information about what's occurring or what
an
occurred on
opinion.
scene and what's occurring during the transport?
When possible, yeah.
And when the emergency personnel, the EMTs or paramedics arrived at Beth Israel, there were 3 patients, correct?
Correct.
And you were assigned to treat 1 patient.
Correct.
Do you recall which patient that was?
Cora?
And prior to EMS arriving, did you learn more about Cora's presentation and what was occurring?
Yeah, so we had heard that, all 3 were in cardiac arrest, and the Cora in particular, they were still working on doing CPR and doing what we call pediatric advanced life support, so medications to try and restart the heart.
Darren,
And they
hi.
also mentioned that they had used what we call a defibrillator to shock the heart to try to restart it.
Good morning,
And they
Wild
were still
Child.
doing CPR when they were arriving.
I'm live on the Big
And
Wild
is this
T.
information important to you as you're assessing a patient coming into the emergency department?
Yeah, it's
Sarah.
important to know, what things look like in the field, how long
Lady
the
in
patient
red.
might have been without a pulse, or how long they may not have been breathing for, so we can kind of expect or know what injuries to look out for, what we can potentially reverse.
And were you aware of the age of Cora?
Yes.
And she was 5, correct?
Yes.
And as far as the medications that you were aware of, what medications had been provided?
So prior to coming to us, she had been given epinephrine, which is the primary medication we use in a cardiac arrest.
And do you know how they had administered that medicine to her?
Yeah, so she had what we call an intraosseous device in her right tibia. Sometimes it's very difficult to get an IV in, so we can go directly into the bone or the bone marrow.
And were you aware of whether she had been intubated en route?
So she was not intubated en route.
When she arrived at the emergency department, were you there to greet the ambulance?
Yes.
And what happens when a patient comes in through the emergency department via ambulance?
Good
So when the
morning,
patient
Rhonda.
first comes in, we immediately have our team, start to sort of take over care, so there's no gap, and then we also get a
We're
sign out
listening to
from
the Lindsay
paramedics and
Clancey
EMTs
trial.
and any other staff that
Lindsay
had been involved in the
Clancey.
case.
And do you and your emergency room staff then perform your own initial assessment of the patient?
Yes.
So what do you do for that?
So initially, we sort of go through our
Thank you, Miss
ABCs, airway,
Cheryl.
breathing, circulation. So initially, focusing on the
Thank you.
primary things, such as making sure we're getting air and oxygen into the patient, keeping the heart going, so continuing CPR at that point.
And as far as Cora went, did you observe that she was breathing?
So she was not breathing on her own.
How about the heart? Did you observe that her heart was beating?
There was no heartbeat.
How about her physical appearance? What observations did you make of her physical appearance?
So initially, when she had come in, some of the things we notice is sort of a blue tint to the skin, which typically, we can see when
Oh,
there's less
wait.
oxygen or lack of oxygen. And then the other things on a quick survey is there was some.
I'm going to pause this for a second. This says they're not supposed to start streaming until Wednesday. I guess today and tomorrow is this jury selection? Because I wondered about that. In regards to Sarah Grace Patrick. Is that what it is? Bradley's wife, good morning. I know, Daisy. Everybody's covering this case. Just interested. Okay. So I'm off by 2 days. I came in here thinking we were about to throw down. I don't know what I was thinking. I was wondering how would jury selection work? Like, they're not going to air that, are they? I wondered about that. Okay, so that's going to be starting Wednesday. But I guess until then, we'll sit here and cover the Lindsay Clancey trial. But starting Wednesday, we'll need to switch over, and I guess that's when they're going to start the live cameras in the courtroom. Okay.
Areas of bruising on the neck and around the eyes, called petechia, kind of little bleeding episodes of bleeding under the skin, and I believe a small amount of blood coming from the nose.
Were you able to make observations of her hands or other parts of her body?
So the hands definitely had that, what we call cyanosis or blue hue.
Now, as far as the eyes, you mentioned petechiae around the face and the eyes, as well as the neck. Did you notice anything else about her eyes?
So the pupils were fixed and enlarged.
Why is that significant to you?
I'm live on
So
YouTube if you want to watch
oftentimes
the trial with
when we
us.
see it coming in, it can indicate two different things. Some of the medications like epinephrine can cause the pupils to dilate, but also if the brain is starting to become damaged or not functioning, then you start to lose initially some of the signals that would make the pupils smaller, so they'll tend to start to get enlarged or dilated if there's brain injury starting or has occurred.
Now, you indicated that when Cora arrived, she was not intubated, meaning she did not have a breathing tube in. Did you and your team attempt to intubate her?
Yes.
And did you do that on your own or with the assistance of other parts of the department of the hospital?
So we had anesthesia
My
there
Coops
after
drinking
we got
Mountain
the phone
Dew.
calls of multiple patients coming in. Typically, we'll have all the help that we could possibly need there to be able to take care of all the patients. So I had an anesthesiologist in the room with me who put the breathing tube in.
In instances where an individual might have suffered some sort of injury to their neck, does that complicate the insertion of a breathing tube?
It can, yeah, because normally you might need to move or tilt the head to get a direct view where you can put a breathing tube in. But when there's a concern for neck injury, we stabilize it typically with a collar or manually. So you don't have the ability to move the head and the neck around to try and get a better view.
Once a breathing tube was put in, were you and your team able to manually give breath to Cora?
Yes.
Now, did you then perform an assessment, a cardiac assessment of her?
Yeah, so in addition to listening to the heart, feeling for a pulse, we'll also tend to use an ultrasound machine in the room where we can kind of get a direct view of heart function.
And you were aware that they had defibrillated her twice in the ambulance. Why is that significant when you're treating a patient that's in cardiac arrest?
So when they defibrillate a patient, it's typically the heart's or might be in a rhythm where it can't pump blood. So it might be sort of out of sync or quivering, where we may attempt to use electricity to kind of shock it back into a rhythm.
Once you performed the ultrasound, the cardiac ultrasound, were there any attempts made further to use a defibrillator or?
Yeah.
Throughout your course of treatment with her, did you continue with various medications?
Yes.
And was CPR ongoing throughout your entire time with her?
Yes.
Were you consulting with any other colleagues or any other hospitals in regards to the care of Cora?
Yeah, so we actually had, in addition to all my colleagues in the emergency room, we had intensive care physicians from Children's that were on the phone with us, kind of working through any things that may have come up in the case, also expecting that they would be receiving the patients from us.
Is your hospital at the Beth Israel equipped to handle this type of pediatric trauma?
So we can do the initial stabilization, but then we need to ship the patients out to either get a specialty care or continued inpatient care.
And how long did efforts in treating Cora continue?
So in the emergency room, roughly 30 minutes.
And fair to say
Oh,
that
30 minutes.
all of
I
the
worked on that baby.
efforts that you made were not successful.
Correct.
And at approximately 1928 or 7:28, did you finally declare Cora deceased?
Yes.
Thank you. I have nothing further.
Anything?
I have no questions. Thank you, Doctor.
Thank you, Doc.
Thanks. Thanks.
Commonwealth calls Dr. Andrew Capraro.
It looks so yellow today. Like the watching of this is so yellow, but if you're just joining us, we have 200 souls over here on TikTok. We are watching the Lindsay Clancey trial live on the Big YT. If you want to come over and watch it with us, or if you just want to listen and chat, please feel free to stay here. Today's live goal is 10 of these soccer balls. If you can throw one, it goes to support the platform. And what we do here, if you can't, tapping is clapping and all of those things, sharing, following me. Everything is interaction. Reposting the live is interaction.
Good
And it's
Can you
all
please state and
appreciated.
spell your
Thank
name for the
you.
record?
My name's Dr. Andrew Capraro, last name Capraro.
They all
And
look
your
like,
date of birth, please.
I got to find
July
another
9th,
feed.
1970.
What do you do for a living?
I'm an attending physician in the emergency department at Boston Children's Hospital
And how long have you done that?
for the last 26 years.
Can you just briefly describe for us the training and education
It looks
you had
the
to
same
qualify for
everywhere.
that role?
I went to Providence College undergrad and then went to Brown Medical School. Subsequently, I went to Connecticut Children's Medical Center.
Mama,
for
that's
my
what I'm
pediatric
saying.
residency,
That's what they
and
look
then
like.
did fellowship training in pediatric emergency medicine at Boston Children's Hospital from 2000 to 2003 and have been attending there ever since.
And what's involved with being an attending at Boston Children's Hospital?
It means that I am guiding the care and treatment for the patients that I am seeing during my particular
It looks a
shift.
little bit different.
are you-
Let's try that one. Let's try that one. I mean, it still looks yellow to me.
Patient, Callan Clancy, as he was
He arrived at Plymouth. He was in cardiac arrest, that they had intubated him and initiated CPR.
Is
And
that
they had
better?
gotten a return of spontaneous circulation, and that they were then going to transfer him to us for further evaluation and care.
And at some
Betty.
point in time, did Callan arrive at your hospital?
That is correct.
And were you able to observe him physically?
Yes.
What observations did you make about his physical condition?
He was
Backdoor
cold on arrival,
confessions.
and he was quite limp, was not making any purposeful movements on his own. His pupils were fixed and dilated, and he had ligature marks about his neck with some swelling of the neck.
And his pupils being fixed and dilated, is that medically significant for you?
Yes, it is.
And why is that?
Thank you
It
so much for
typically means
that. Thank you,
significant injury has
Backdoor.
happened to
Thank
the
you.
brain, such that there is brain swelling that has sort of what do I want to say? It has overwhelmed the capacity of the skull, such that the swelling has made the brain sort of herniate through the base of the skull.
Does that mean the brain's
Heartbreaking.
swelling so much it's pushing through the skull?
Correct.
And what observations did you make of his heart rate?
His heart was beating, and we did have to provide him with an epinephrine drip to keep his heart rate.
Kim
and his
Scott,
blood
thank you
pressure
for
within
the
normal limits,
jewels.
but it was beating on its own.
And how did you know that you had to provide
Thank you
the
for the
epinephrine for him
heart.
to
Thank you,
stabilize that
Backdoor.
heart rate?
It was initiated at BI because they had noticed that his blood pressure was low, and you need to have normal blood pressure for the blood to perfuse your organs and keep them healthy. And so we were looking for certain parameters to sort of maintain that, which we did on that epinephrine drip.
And when you say BI, you're referring to Beth Israel?
Yes, I'm sorry about that.
That's okay. And so as far as his breathing, was he breathing on his own?
He had been intubated at the outside hospital, and he was needing a ventilator to breathe for him. Occasionally, he would have sort of a breath on his own, we would notice. We were able to see that because when he attempted to take a breath on his own, he would trigger the ventilator to continue that breath. But it was rare. For sure, he needed the ventilator to maintain his ventilation.
Would it be fair to say that the majority of his breathing was being done by the ventilator?
Yes, the vast majority of his breathing.
Now, once you have received this information while he's coming in, and then you've made your own physical observations of Callan, are there certain tests that you have run on him?
Sarah, 30
Our
jewels
job,
for a flower.
once we received
Thank
him was
you.
to perform further evaluation
Sarah.
and stabilization to help determine what the next steps of his medical care would be. So prior to him arriving, we
Thank
had
you, Kay.
contacted our trauma team and our ICU doctors to let them know that he was coming and that we would need their assistance. And then under my care, we performed some routine blood work, so a head CT, a neck CT, and a chest X-ray to sort of help us guide the next steps.
And from the head CT and the other testing that you did, what were you able to learn from the results of those tests?
The head CT in particular showed significant brain swelling consistent with hypoxic ischemic injury, which was most likely, or which was the most significant finding that we found.
So could you please explain for us what is hypoxic ischemic injury?
Hypoxic is just a fancy word for not getting enough oxygen, and ischemic is just a fancy word for not getting enough blood flow. And so when your organs don't get enough oxygen and blood, they sort of suffer injury and therefore get to swelling. And so his brain was showing evidence of that.
So would it be fair to say that his brain wasn't getting enough oxygen and blood flow, and then because of that, it was damaged and swelling?
Correct.
Now, this type of swelling and injury, as you're describing it, can that be caused by strangulation, the injury of the brain?
Oh,
Most certainly.
And
so horrible to listen
you
to.
mentioned earlier that you did see some marks around his neck. Is that correct?
Correct.
And what were those consistent with?
Strangulation of some sort, most likely from an object, based upon the linear aspect of the bruising.
And when you say the linear aspect of the bruising, does that mean it's in a straight line?
Correct.
Now, once you had the results of this testing, was there, did you make a decision on what to do next?
Yeah, the main thing was to help us figure out, did the patient need to go to the operating room for some sort of other procedure to help with this, or was this something that could be dealt with medically? And so once we had the results of the head CT and then the neck CT as well, it was felt that the next appropriate step in his medical care would be to be transitioned to the intensive care unit for them to take over care.
Why was it that surgery was not an option to help Callan in this situation?
The judge
Yeah,
looks
the neurosurgery doctors were there to sort of
super
help us make that
tan
decision. There was
with
no
this
significant
yellow
bleeding, for example, that would need to be evacuated. There
overlay.
was nothing that they felt from a surgical point of view would help alleviate the problems that we saw in the CT.
Okay. And so was his care transferred to the ICU?
That is correct.
And once Callan was transferred to the intensive care unit, did your care for him end at that point?
Correct.
I have nothing further. Thank you.
Thank you. Mr. Reddington?
No questions, thank you.
Oh, thank you, Doctor. Please step down. Thank you.
All right, they're going into the next witness. 4.2 thousand likes over here on TikTok. 247 souls. If you're just joining us, we are talking about the Lindsay and watching the Lindsay Clancey trial. She was accused of taking the life of her 3 children. She done it. It's just a matter of, is it going to be a not guilty by way of insanity, or what is the jury thinking of right now? Was it a misuse, because she has a civil lawsuit out there. Was it a misprescribed cocktail of medications that drove her to do this? Or do you think postpartum, or is she just flat out a murderer? Let me know what you think. I mean, no, I don't think
Good morning,
so.
Doctor.
Good morning. Going on here.
I don't think so.
Thank you.
Hey, he's on
Good morning.
video
Can you
somewhere
please
else
state and
doing
spell your
something
name
else.
for the record?
Surely. My first name is David. My last name is Casavant. It's spelled Casavant.
And your date of birth, sir?
5263.
What do you do for a living?
I'm an ICU physician at Boston Children's Hospital.
Can you briefly describe for us your educational and training background?
Sure. I went to college out at Holy Cross in Worcester and then to medical school at Boston University. I did my initial pediatric residency at Mass General Hospital, and then went back and did a fellowship in ICU medicine at that hospital as well.
And where do you currently work?
I currently work at Boston Children's Hospital in the medical surgical ICU.
And how long have you worked at Boston Children's Hospital?
18 years.
And have you always worked in the ICU there?
Yes.
I want to direct your attention to January 26, 2023. At that point in time, did you take over the care of a patient named Callan Clancey?
How did she get out of the
And
window?
prior to taking over the care of Callan Clancy,
Stephen
did you,
Crabtree's
do
in the
anything
house,
to,
everybody.
familiarize yourself with his treatment and care.
Yes, I did. One of my colleagues had taken care of him the day before in
Stephen,
the
it's
ICU.
good to see you, sir.
And I spoke with her, and so I was familiar with his case.
Okay. And did you also review reports and testing that had been performed while he was at the hospital?
Yes, I did.
Okay. And after reviewing the reports and the test results and speaking to your colleague, can you tell us what you learned from all of that?
It seemed that Callan had a severe neurologic injury based on both testing and the examination that I did at the time.
And when you say a neurologic injury, is that a brain injury?
It's a brain injury. Yes, it is. Yeah.
And did you review specifically a head CT scan of Callan?
Yes, I did.
And what did the head CT scan show you or tell you about his condition?
The head CT is a picture of the brain, which was done in the emergency room when he was admitted to Boston Children's Hospital.
Melissa, thank you for your
And
follow.
the CT scan showed an enormous amount of swelling of the brain itself.
Doodlebug is on YouTube.
And that the swelling of the brain, is that medically significant?
Very much so. When you have an injury to the brain that is caused by anoxia, which means a lack of oxygen, I describe this with families that the injury is very much like being out in the sun. You don't notice it at the time, but swelling occurs over the course of time. And one of the things with a lack of oxygen to the brain is the injury occurs and then swelling starts to happen over the course of time, typically peaking at 48 to 72 hours. When you see swelling that happens that early in a case, as in Callan's, it means that there's been a very significant lack of oxygen and therefore injury to the brain itself.
I was wondering the
So, for
same thing.
example, some types of injuries that would withhold oxygen from the brain
Both
would
Kims.
be more mild, and the swelling would occur over time. Is that correct?
That's exactly correct. Yes.
So if a severe injury happens that
This is
withholds
live, yes.
oxygen from the brain, that's when you see
As
that
far as I
immediate
know,
swelling like
everybody, do I
Callan had.
have a
Very
live
much
feed?
so. Sort of the comparison of
Because the other day I
a
played something
sunburn
old.
to a burn that you might get from a stove. This was a
I'm
stove.
pretty sure this
It's
is
very,
live.
very profound.
Did you perform a physical examination of Callan?
I did.
And what did you observe?
Well, one of the first things that I noticed as I approached him was that he had a breathing tube in place, and I knew from my colleague that he was not on any sedation, which is very difficult to tolerate. Having a breathing tube through the vocal cords if you're not sedated, and he was not sedated at the time. The next thing is that when I approach a patient in their bed in the ICU, we always start with a quick introduction that we're going to be coming near them in case they're asleep. And I usually start with something along the lines of, I'm Dr. Dave, I'm just going to listen to your heart. And I'd usually address them by name and to see if they start to respond.
Thank you for your follow,
and then
Becca and
I'll
Laurie.
go ahead with the rest of the exam, but that's just to sort of warn them that someone might be touching them. And then they'll listen
you
to
for your
heart,
heartbeat.
lungs, and then to move forward to see if how responsive they are. So if you get no response at all
Thank you, Nicole.
from the initial, just using your voice, the next thing is and then from the exam, if they don't move around, then you start to sort of think, well, let's see how responsive they are. And so the next thing is sort of a gentle touch off into the bottom of the foot to see you stroke the bottom of the foot and you see if they pull away. And then you can move. If you get no response from that, we'll do something that's a little bit more noxious or painful, where you can sort of pinch a little bit of skin to see if they start to react, or pushing on the fingernail and the nail bed pressure, which is actually very noxious. And if you can see several types of response, either no response, or you can see a very specific response where they pull away from that area, and that's a specific, or you can see generalized response, which are all sort of graded along those that as we're sort of getting a sense for what their level of consciousness was.
So
It
if I could
is,
go over
Rhonda.
a few of those things that you just mentioned.
Sorry.
You said that that the first
Somebody
thing
just
that you
coughed.
noticed that was significant was that Callan
Me.
had the breathing tube in place through the vocal cords
Yes.
without any sedation. So without sedation, would having a breathing tube in that place cause pain?
Yes. No one would be able to tolerate it.
And so Callan was able to tolerate it without any sedation.
Yes.
Would that indicate he wasn't feeling that pain at that time?
Yes, exactly.
And you mentioned that you would address the patient by name and talk to them. Was there any reaction from Callan when you did that?
No, there was not.
And then you mentioned you would rub maybe something along the foot. Was there any reaction?
No, there was not.
And did you do what you described in pinching the fingernail or pinching somewhere on Callan to see if he responded?
Yes.
And did he respond?
No, he did not.
And what did these interactions and tests on Callan tell you about his condition?
This told me that he was unresponsive. He was unresponsive to both things that would cause discomfort and things that would cause pain.
Did you also do anything in terms of looking at his pupils and any tests
Bless his
on
little
his
heart.
eyes?
Yes. So after all the other things that we look
Thank
at the
you,
pupils,
Aaron.
and so one of the things is we have a reflex response. If a light is shown in an eye, the pupil constricts. And what I noted about Callan was that his pupils stayed widely open and did not constrict.
Oh.
And when someone's pupils stay open and wide when you shine a light in them, what does that indicate medically?
Well, the eyes are a direct extension of the brain, so that's why we focus a lot on them as an area of investigation. And the lack of a response to light indicates that there's some abnormality to that, and in this case, it was a brain injury. There's medications that can keep your eyes open if you've ever had an eye exam, but that was not the case with Callan.
And just to be clear, when you're talking about brain injury, we're not talking about some type of trauma that was inflicted on the brain. You're talking about the lack of oxygen and blood flow causing an injury to the brain, correct?
That's exactly correct, yes.
At that point in
Morning,
time,
Tina.
did you work with another doctor to do more in-depth testing regarding his neurological status?
Yes. So at Children's, we have multiple teams that come together for a patient, for many patients. But for Callan, the neurology
Thank you
team
for using
was
your
there from the
stickers.
beginning. And when in a case like this, when we see no response in an unresponsive patient, we start to get our neurology team. And one of the things we start to do is brain death testing to see if they could be what we call brain dead, meaning the brain itself is not functioning, and that even though their heart is still beating.
How is it that someone's heart can be beating if their brain is dead?
That's a really good question. So there's actually two parts to the nervous system. The one is the part that we see the most in people when they react, and they react to us and they speak and they do things. The other one is the autonomic or automatic system. And the automatic system is largely in charge of the things like the heart, if the heart has not been injured. And so it was sort of continuing on.
And does that give you any indication, the fact that the heart was still continuing on, about where
We're
the
watching
injuries
it
were in the
together
brain?
on YouTube
Yes, it does actually.
Top.
Yeah, that
at
Where would
Steps
that be?
Case
yeah,
Files.
so the large part of the brain that we sort of think of as when we see the pictures of the brain, that's the cerebellum, and that's the biggest thing in humans that is most developed, and that's in charge of our consciousness, our reaction to things, whereas the brain stem, which is another part, and that's really part of the autonomic system, and that's the same in almost all vertebrates and mammals, and it's much more automatic, and so it tells me that it seemed the cerebellum, which is that part that makes us the human side of what we do, that's much more sensitive to a lack of oxygen, to an anoxic injury. And it told me that was really where that injury was in that part of the brain, much less so in the brain stem itself.
So would it be fair to say that the brain stem itself that controls those automatic responses was still functioning somewhat, but the part of the brain that made Callan was not functioning?
That's exactly correct, yeah.
And can you describe for us the brain death testing?
Sure. So the brain death testing at Boston Children's it's a very strict testing that includes some of the things that I just mentioned, but we work with our there's a checklist that we work on with our neurologic colleagues, and we sort of go through each of what we would expect for responses from someone, and we actually then work through different
Really, Laurie?
of the nerve sets that we would expect them to respond to. We have it set up so that there's an ICU physician is there, and then a neurologist is there, and the neurologist and the neurology team, they're the ones who perform
So you
the
knew
brain death
Lindsay when she
testing.
was young, I guess.
And then the test is then repeated again 24 hours later, just to make sure that there's no piece of that is different or incongruous with a diagnosis of brain death.
And while the neurologist is doing this testing, are you there present watching the testing and seeing the results as it
Laurie.
happens?
Absolutely, yeah. So we're sort of committed to being there for the whole time. And the brain death testing itself goes through some really basic things. Again, as I described
Did she
earlier,
seem normal?
things that would be painful and
Who's
do they
her
pull away or not.
parents?
the eyes, the looking at the reflexes.
Where's
of the
her
eyes.
parents?
There's also other reflexes too. Things like if you stroke the cornea, which is the front of the eye, people blink. And there was, and that's, so the blink reflex,
Thank
cough,
you, Carol.
gag.
A
There's also a
corgi.
reflex where they actually put
Carol,
cold water
over
into
here
an
on the
ear.
YouTube.
And
Thank
that
you so
gives
much,
people,
ma'am.
a
I appreciate you, Carol.
disequilibrium.
Thank you so very
And so
much.
those are all the things that we think about. And then also too, there's some breathing components to that as well.
Is one of those breathing components an apnea test?
Yes, it is. Yeah.
And what is an apnea test?
So apnea is a word that just describes describes a lack of breathing.
And how do you test that?
So in a patient such as Callan, what we do, and in any patient when we're doing brain death testing, what we actually disconnect them from the ventilator. And the reason that we do that is we want to see if that autonomic
hadn't heard
system
folks
in the brain will
question
start to
Patrick
react
until now. And you're the second
as
one
the
this
carbon
morning.
dioxide starts to increase. So our body makes carbon dioxide all the time. And the way we get rid of it is by exhaling. And where we breathe in fresh oxygen, and then we breathe out CO2. And what we do is we disconnect from the ventilator to see if, knowing that their carbon dioxide will start to rise, and the normal response for that autonomic part of the brain would be to sort of increase breathing. That's why we breathe when we sleep. Because as we go to sleep, the conscious part of our brain stops, but the autonomic part kicks in, and then we breathe right through our sleep because that carbon dioxide rises.
So in a patient who has brain death, would it be accurate to state that as the carbon dioxide level increases, the automatic response would be to take a breath to get more oxygen, but a patient who's brain dead won't do that?
That's correct.
And did you do all of these tests, or did the neurologist do all these tests on Callan while you observed?
Yes, they did. Yeah.
And did he have any response to any of the physical tests where you were looking for a reflex or a reaction?
No, he did not. No response to any.
And what was his reaction or results on the apnea test?
So the apnea test, again, we do all the brain testing one day, and then we wait at least 24 hours for the second one. The first, and what we expect with the carbon dioxide is that it will increase.
On the YouTube.
It's all in writing for our protocol, that it will increase by 20.
Thank you so
or get to a level of 60.
Oh,
a normal
thank you.
CO2 would be around 40. And the first time we did that, on the first day, it actually went to 59.7, not 60. And again, it was in our protocol as has to get to 60 or increase by 20.
Thank you, Laurie.
And,
I'm interested to
I
talk to you
actually
more, actually.
Talk to my colleagues, including
Yeah.
neurology.
Thank you
I
for
said,
coming by.
I know this is very close. It's 59.7, but it's not 60. I repeated that piece of the test later on that day to make sure that it was valid. And as I say, I checked with everyone to make sure that I was doing the right thing. They all agreed that we should just, and the second time it went to 87. So that was, everything else was the same. And we made sure that there's things that we look at too to make sure that there's not on any medications, that there's no changes in his temperature, there's no abnormalities of the salts in the blood, what we call the electrolytes. So all those conditions were the exact same. And I repeated that later on in the day, and it did come back positive.
Why is it so important that you meet that specific criteria? Why is 0.3 of a point so important?
Well, I wanted to
Thank
make sure
you,
that there was
backdrop.
no question
Backdrop,
about
backport.
the data that we were.
I appreciate you
that we
coming
were
in here. I
gathering at the
really do.
time.
Thank you so much.
And you said that this testing is again repeated 24 hours later, correct?
Yes, it is.
Why is that?
Well, that's just to make sure that if there were any lingering effects of medications, if there was anything that else might have changed in the patient's level of alertness or level of response, to make sure that it still meets all those requirements 24 hours later.
And is it because you want to be sure that there's brain death before you remove life
That's
support?
the third
Yes,
person
and
coming
again,
in here
it's too important.
beating up on
It's too
Patrick.
important a discussion and a gathering of
What
data
is this?
to not be very exact about it.
And so when you did observe the testing and then the following day on Callan,
What's
were the
going on
results
right
the same
now?
in terms of no reaction and the carbon dioxide increasing?
Yes, they were.
This is
And
Hate
at
on
that point
Patrick
in
Day.
time, did he meet brain death criteria?
He did. He met. So we had determined that it was that he had met death by neurologic criteria.
And at that point in time, was a decision
It's
made
too late.
to stop life support?
If Patrick
yes.
done it,
Yes,
it's
it
too
was.
late,
And that's done
everybody.
in consultation with the family, his father, correct?
We are almost
Yes,
at the end of
that's
this
true.
trial.
Okay. And was life support ended for Callan Clancy on January 27th, 2023?
It was, and one of the things is there's when you determine that someone has met criteria for neurologic brain death.
Good morning, Kelly.
That although we know that their brain is not functioning at that point, there's often a period of time where we don't have to remove, his heart is still beating, so we don't have to remove the endotracheal tube at that time, and we often will give families, once it's been confirmed that the brain is no longer functioning, we often give families a period of time to able to process it and a window of time. Sometimes there's relatives who will need to travel and things like that. And so we'll often then choose a time later on to accommodate the rest of life, knowing that they're stable at the time to when we would actually remove the tube, and that would be the declaration of death.
Tell me how
was
you
that
feel
done in this
Patrick
case?
was
Family was given an
involved.
opportunity to
The
see
comment.
him, and then life support was ended, and then his heart stopped.
Yes.
Tell
exactly.
me in the
He was declared
comments
deceased.
Yes.
how you think Patrick was involved. I mean, I'm truly
Train ready,
interested
Jim?
because I've never thought of him as being
Thank
involved.
you, Doctor.
Thank you so much.
I've always just thought of him as probably a cheater. Okay, well, I'll give him that. He's a cheater, probably. I don't have enough evidence. And then I just thought victim. Oh, I can't scroll up. There are too many comments. You got to say it again. I'm watching two screens. I'm live on YouTube. Over here, we have 277 souls. Over on YouTube, we have 21 souls. If you want to watch the trial with us and interact in the comments, please come there if you want to, or you're welcome to stay here and listen.
South Shore, they all can go in.
12.6 thousand likes, 279 souls in this room right now. Today's live goal is 10 of these soccer balls. We have none of the 10. If you can throw one, please do so to go, because it goes to support my platform and what I do here.
Yeah.
If you can't, I understand. Tapping is clapping. That's free. Sharing's free.
Thank you.
Reposting's free. I'm going to challenge you to get to 25,000 likes.
Commonwealth would call Kelly McDonough as next witness.
They are
I'm sorry,
calling
can
the
you-
next
can you say your
witness.
name again?
Kelly McDonough.
Okay, sure.
Why would she be taking the frame, though? Why would she be taking it and not saying, I didn't do it? Why would she do that?
Hey, good morning.
Good morning.
May I inquire? Thank
Yes,
you.
please.
Good morning. Could you please tell the jurors your first and last name?
Kelly McDonough,
Can you spell your last name for the record?
McDonough.
And what do you do for a living?
I'm an emergency medicine physician.
And how long have you been a physician?
11 years.
Can you tell us a little bit about your educational background?
I went to medical school at the University of New England in Maine. I did my residency at Kent Hospital in Rhode Island. I subsequently worked at Kearney Hospital in Dorchester, and I've been at South Shore Hospital since 2021.
And in what, are you primarily in the emergency department at South Shore Hospital?
Correct.
Have you been in any other department at South Shore Hospital?
No.
Are you licensed to practice in Massachusetts?
Yes.
I'm going to draw your attention to January 24th of 2023. Were you working in the emergency department that evening?
I was.
At some point, were you advised that a patient was being
I don't know.
brought into your emergency department?
I was.
And were you aware of that patient being Lindsay
Ooh,
Clancey
Jenny.
with a date of birth of 8/11/90?
Yes.
And what kind of information were you given upon learning that the patient was coming here? What were you expecting?
She was
to
born in
receive?
I
1990.
was expecting a trauma 1 response, a patient who had fallen out of a window from a height,
Oh,
and didn't know much more than that.
Okay, and so when you say
I feel
trauma
like the
one,
90s
what
were
does that
just
mean
yesterday.
for you.
So we had 2 designations for trauma responses.
So I have
a
to
trauma 1
remember
and a
that
trauma
that's
2,
over
and there's certain
30
criteria for
years
each.
ago now.
And there's a long list of criteria that are determined by the resource nurse who receives the EMS call.
Okay, and so when we say 1 and 2, which is more serious than the other?
Trauma 1.
And so what do you do to prepare when a patient is coming in and you know coming in that it's likely a trauma 1 situation?
So we gather
She
in
was
the trauma
4
room and make
when I
sure
got
that we
married.
have all available staff needed to take care of the patient.
That's why I'm
And
feeling
what
old
kind
right
of
now.
staff are with you in the room, in the trauma room?
So for a trauma 1 response, it would be the emergency medicine physician. It would be anesthesia.
Yes.
The
Are they
trauma
live?
surgeons. Sometimes neurosurgery will be there.
And
Are
fair to
they
say you
live,
also,
Alyssa? Because
have
I
a whole
thought
host
that they
of
were
other
going
staff,
to
including
be live on
nurses,
Wednesday.
emergency room techs, all of those
Thank
people
you,
are also available
Kelly.
to assist and if you need it.
Correct.
Now, when this individual came in, when Lindsay Clancey came into the emergency department, were you aware from EMS that she had already come in with some sort of neurological deficits?
I think that from my best recollection, we knew that she was unresponsive, found down outside of her home.
Were you advised that it appeared she might have a spinal injury
Yes,
and that she was not she may have been moving her arms and her head, but not her legs?
correct.
Now, when the team was assessing her in the emergency department, what types of
Where did he
steps do you
go
take to perform that
on the
assessment
way, Jenny?
of the patient?
So there's a series of steps that we go through to assess a trauma patient that are followed every single time. ABCs, airway, breathing, circulation, and then we do a secondary survey.
Okay. And in this circumstance, was the patient breathing?
Yes,
And when she came into the emergency department, was she breathing on her own or intubated?
she's breathing on her own.
At some point, did the ER staff have to intubate her?
Yes.
And why was that?
For airway protection, there was a concern that maybe she would have a head injury and she would decompensate later. And so to protect her airway, she was intubated.
Now, is that a standard protocol when there's concern for head injury?
Yes.
Did you see any obvious signs of a head injury when she arrived into the emergency department?
No.
What kinds of things would you see if somebody had an obvious head injury?
You might see bleeding or lacerations or abrasions.
Now, did you observe any other obvious injuries
I'm
to
having
this
a hot
patient?
flash.
I did. She had some superficial lacerations of her neck and wrists bilaterally.
Do you recall if she came in on a backboard with a C-collar?
I'm
She did.
fine.
And do you remove the C-collar at some point to assess the patient for injuries?
We didn't completely remove it temporarily to visualize and feel her neck and then put it right back on.
Okay, and you said you did observe some injuries to her neck, correct?
Yes.
I'm just going to show you some photos that have been already marked, if that's okay, on the screen next to you. This has been marked as exhibit number 111. Is that an accurate representation of the neck injuries you observed?
Yes.
You also indicated that she had some other injuries to her wrists.
Yes.
And I'm just going to show you 112. Is that accurate as to the injuries to the wrist you observed?
Yes.
Now, you described the injuries to.
So do you think that she done those injuries to herself? Do you think she done those injuries to herself?
What part of the.
Where did her
body that
injuries come
injury
from?
is?
And how did she get out of the
Describing
window?
the one that's sort of open.
Yes.
Yeah. So that's the anterior aspect of her wrist.
And were you able to examine that injury?
Not in detail.
Okay. Was it something in your emergency, your assessment of the trauma 1 situation, was that something acute that you had to address?
No.
And is it fair to say that that injury goes through kind of the subcutaneous tissue of the skin.
Yes,
Did you observe any injuries to an artery or a vein or anything in that area?
I did not.
And then just showing you Exhibit 113, which is the other wrist. Same thing. Did you observe anything in your assessment, your trauma 1 assessments, to say whether these were acute at the time?
I assume that they're acute.
Okay, but as far as treatment of them, did
That's what
they require
menopause
you
looks
to
like.
immediately address it
No.
to manage blood flow?
Mm-mm. No.
What was the more serious
Discord.
or what was the focus of your assessment of her in the emergency department?
I think the main concern was for a head injury and or a spinal cord injury.
And you said that as part of the assessment team, you had a neurosurgeon available as well as a trauma surgeon, correct?
There was no
Wow.
surgeon there that day.
Okay. Was there a trauma surgeon?
There was.
Who was that?
Dr. Christina Carpio.
Did you order any series of tests in order to help you assess the nature of whether there was any head injury or what the extent of the spinal injury could have been?
Yes.
What kinds of tests did you order?
CAT scans.
As part of the emergency room protocol, do you also draw blood for
Wow.
patients that come in?
Yes.
And how is that usually done?
It's usually done on arrival by the nursing staff.
And do they draw blood according to a physician's orders, or do they draw blood for various purposes? Explain to us how that works.
Mhm. So it's usually like what we call a rainbow. So they just draw all the tubes of blood as soon as the patient arrives in anticipation for orders.
Okay. And so what happens to the blood after somebody in the emergency department takes it from the patient? Where does it go?
It gets tubed to the lab.
And fair to say that at South Shore Hospital, they have a
This is
pneumatic tube
interesting
system,
to
correct?
me.
Correct.
And that it goes to a
Because
separate laboratory.
The judge was adamant that her
And
trial
once
start
a physician
today.
then assesses a patient
What
and
is the
determines
delay?
what kinds of testing
Somebody better
needs
be
to done on
bleeding.
those
That's all I
samples,
gotta
how do you
say.
communicate that to the laboratory?
So orders are put into a computer and they go through the computer to the lab.
And as you're treating a patient, is it oftentimes necessary to change the orders or order additional tests?
Yes.
Yes.
And so in this particular case, blood and urine was collected from Lindsay
Wow.
Clancey upon her arrival, correct?
Correct.
And then sent to the lab.
Yes.
Now, going back to the imaging
Sarah
tests,
Grace
you
Patrick.
said that there were some CT scans that were
Court.
ordered.
Correct.
That was supposed to
What
start today
areas
has
of the
been
body,
delayed.
were the CT scans for?
A new
It was her
date
entire body, her head,
to be
her neck,
set by the
her
end of
chest,
the
her
week.
abdomen, and her pelvis.
Now, as far
Wow.
as the CTs for her head, were there more than one CT test for the head?
I don't remember. I'd have to look at my record.
Well, what are the normal, or what are the options for CT head scans?
It's usually just a CT head plane, but you could also do a CT angiogram, depending on your concern for injury.
And do you
Wow.
recall which one you ordered here?
For a trauma one, it would be a plain CT head.
And why do you order that particular test?
Well, we're trying to assess for skull fractures, intracranial bleeding, things like that.
And when you say a plain CT, what's the exact order that's put in for that type of a CT?
CT head.
Weird.
Okay, and are there CT heads with,
Thank you,
with
Wendy.
contrast?
There are.
So much.
And are there CT head scans without contrast?
Yes.
And approach witness. Just gonna show you some documents, if that's okay.
Sure.
I apologize, there's a little series of pagination, so I'm just gonna draw your attention to this page that's black. If you could just take a look at it.
Sure. Mm-hmm.
Okay, and I'm just gonna flip to the next page as well. The next page is blank, but is this the extent of what you would have received as far as information regarding a head CT that was done without contrast?
Yes.
And I'm going to just draw your attention again to another flagged page.
How many
here.
people in here, by the way, while she's going through that, saw Robbie Harvey getting in that water? Nasty as hell.
And does that reflect the report you would have received for the head CT ordered with contrast?
Yes.
And in addition to getting a report from imaging,
He's dedicated. I wouldn't have gotten
received
that water.
some actual
I'm like-
images, correct?
Yes.
And do you review those?
Yes.
In this
No new
particular
info, though.
circumstance, when it came to the patient of Lindsay Clancey, was there anything remarkable in either of those head CTs?
Not that I recall.
And in fact, the head CT with contrast
I know, Sarah.
indicated the impression was unremarkable. CTAF had no evidence intracranial
Robbie Harvey
aneurysm,
docks me.
arteriovenous malformation, or abrupt occlusion, correct?
We all know
What does that mean?
we don't like each
It
other.
essentially means it's a normal study.
But he did get in the water. I'll give him that. He did get in the
Now,
water.
as far as the
But he
other
better
CT
make sure he's
scans
got
that
all
were
his shots.
conducted, there were findings, remarkable findings on some of the others, correct?
Correct.
And what did they reflect in your experience as far as her injury goes?
From what I can recall, I know she had a thoracic spine injury.
He's actually quite mean. off the
And how
camera.
about the CT that was done of the chest area?
I don't
Lord
recall.
Jesus, forgive me today.
If I may approach.
Yeah, nothing new. Just Robbie Harvey wading around in swamp water.
Does that refresh your memory?
Yes.
And what was the extent of the result from the chest CT?
So it talks about her thoracic spine injuries.
Okay.
Mm-mm. Sarah says she hopes he doesn't get an infection. That water nasty.
Now, after reviewing all of the images, all of the CT
This is
scans that
live,
were done
Lauren.
here, the cervical spine, the head CTs, the thoracic spine, what was the plan for this particular patient? Was she able to be treated further at South Shore Hospital?
The decision was made by the team that her injuries were too severe to stay at South Shore Hospital, and the decision was made to transfer her to a tertiary care center.
Were you able to stabilize her before transporting?
Yes.
Is that something that's important to make sure our patient is stable before sending him off in the ambulance or a helicopter?
Yes.
And so as far as this particular patient goes, are you aware of whether any surgical intervention had to be done before she was stabilized and transported?
I was not aware of any intervention being done.
And again, you had Dr. Carpio, who was also there to assess that.
Correct. We work as a team.
Kind of going back to those injuries on her neck and her wrist very briefly. Can you explain to us the difference between bleeding in maybe an artery or a vein and how that might present itself in an emergency situation?
Venous bleed would be a little bit slower, darker blood, and arterial bleed would be pulsatile and bright red.
And is it fair to say that when you strike either an artery or a vein that they're of different pressure systems, and so the manner in which the blood comes out is different?
Yes.
In either
Didn't somebody in here
circumstance
say-
where, an artery or a
Didn't
vein
somebody in here
is
say a
struck
nurse
or
would
nicked or
know?
cut,
A nurse would know
would
how to
that be
cut
something
that
you'd have
without
to
being
stabilize
superficial,
for a
without it
patient
being
in order to make sure
life-threatening?
that they don't bleed out?
Yes.
Was that done here?
That's the
It was
third
listed.
person that's coming up in here on Patrick.
Now, this particular patient at some point
Are y'all going
was
to get
noted
each-
to be.
Are y'all going to get each
I think
other?
it's- was
Where are you
referred
from?
to as
Where have you
hypothermic.
been?
Do you recall that?
Yes.
Do you recall at what point in your treatment of her was that noted? Was it as she was coming into the emergency department, or did that develop while she was in the emergency department?
I don't recall.
What was the course of treatment for a low body temperature?
We placed something called a bear hugger on them, which is a warming blanket.
And can you explain to us what could cause a person's body temperature to drop to, I I think it was 82.1.
There are many reasons, but it could be a metabolic disarray or exposure.
In this circumstance, did you know what the source of the drop in the body temperature was for Ms. Clancy?
No.
And do you recall how long she was in the emergency department before she was transported approximately to the Brigham?
I think it was about 4 hours.
At this time, Your Honor, I would move to enter into evidence a copy of the South Shore Hospital medical records for Lindsay Clancey from January 24th, 23 as the next exhibit.
Is that by agreement? All right, that may be admitted. Or they may be admitted.
And I would also move to enter as the next exhibit a certified copy of imaging records from the South Shore Hospital for Lindsay Clancey from January 24th, 2023.
All right, it may be admitted.
That woman talking into that mic that's on her mouth. Does that take the place of the transcriptionist?
So finally, Dr. McDonough.
Now they just talk
did
it in there, or how does that
This
work?
defendant received surgery at South Shore Hospital.
Not that I'm aware.
Did you observe any cuts, abrasions, or blood on the area of her head?
No.
And based
Speaking
on
in
your view
code?
of those findings on the CT scans, was there any noted injury from the head CTs that you could tell?
No.
And were you able, after using that bear
That's
hugger
interesting to me.
device, able to get her her core body temperature back up to normal?
I don't recall.
Did you ever observe those wounds that you observed on her neck or her wrists ever start bleeding actively again?
No.
That woman.
I have nothing further.
Mr. Reddington.
The,
Morning.
the
So,
The court report
would you agree
that
with me
usually
that when
takes
Lindsay was brought
transcript
into the
and
South Shore
shorthand
Hospital that she was
I
unconscious?
mean, I've seen this is not a new thing. I've always wondered. I guess that's
I recall
how they
her
do
eyes
that.
being open, but she was nonverbal.
Okay.
Do
So
they just
as
talk in there
an
like
experienced,
essay,
emergency room doctor, can you tell me when someone's
I don't know.
unconscious, what is that? What are the symptomology of it? What does that mean?
Usually means they're completely unresponsive with eyes
Yes,
closed.
that Kim.
Was she responsive?
Not verbally.
Oh, that's cool,
Was she
Alex.
responsive at all?
She was responsive to pain.
So that means that you would do something to cause pain, perhaps the bottom of the foot or whatever it is, to see if they have
Gift
a
gallery is open,
reaction.
by the way.
Correct.
And would you agree with me that when people even have very, very serious brain
We've
injuries,
dropped down to C League,
that they can respond
but the gift
to
gallery
pain
is open.
stimuli?
There's donuts,
Sometimes.
art,
Sometimes.
galaxy,
So her eyes were
flying
open.
jets, fireworks,
Were
orgy
her
cords.
pupils equal
Anything
and
you can
reactive to
throw
light?
goes to
I
support
don't
this
recall.
platform.
You don't recall.
And it
What
allows
does it
me
mean
to
with
be here with
PERL,
you,
pupils
watching
equal
these
reactive
trials,
to light?
talking
What does that
about
mean?
it, standing up for
Exactly
folks.
what you
This
just
is
said.
the
It means
Lindsay
her pupils are
Clancey
equal and reactive to
trial.
light.
So
And as a
anything you
doctor,
can
what does
do
that tell
is
you?
much appreciated. Thank you.
It tells me that there's no significant neurologic injury.
And in this case, you don't recall if her pupils were equal or reactive to light?
I don't.
Okay. And that's when you take the little flashlight sometimes and you put it over the eye and see if there's constriction of the pupil.
Hello.
Correct.
Did you do additional evaluations of her to see what her neurological function was?
She was pretty quickly intubated from what I recall. So after that, it would be difficult to assess her neurologically.
Sure. Was she on any pain medication, if you remember?
I don't remember.
You recall, did she have difficulty being intubated? I mean, would you agree with me that if you're not under some type of medication or sedation or unconscious, it hurts to be intubated, doesn't it?
We wouldn't intubate somebody without first giving them some induction medicines.
Okay. So what would the induction medicines be?
They're not universal.
Well, what
That would depend on the
what are
case.
the induction medicines that you used on Lindsay Clancey?
I don't know. I'd have to refer to my record. And also, I wasn't the one who did the intubation.
So she was intubated, had the tube coming out of her mouth. She's laying on the table, and you are continuing an assessment. You were the lead doctor in the emergency room for Lindsay Clancey, right?
wouldn't say I was the lead. I think the trauma surgeon and I worked together.
Right. Her temperature, her core body temperature was 82 degrees. Is that right?
If that's what the record states, then yes.
I'm sorry?
If that's what her medical record states, then
Well,
yes.
as you said,
Her
here, you don't
lawyer
know what her
sucks,
core
yo.
body temperature was?
I saw her 3 years ago. I see about 200 patients a
I'm
month.
sure you're very busy, but this is a murder trial, doctor. Did you review your records and your notes?
I'm happy to
Objection.
look at my record if you bring it
Did
here.
you review your records and notes before you came in here today to testify on this case?
Sir, I did, but I don't have a photographic memory.
Did she regain consciousness at all while she was in your emergency room?
No.
I
Can you
don't
tell me
like
what
him, Dave.
CSF is?
I don't like him.
Cerebrospinal fluid?
You can love him, but I don't.
Is that what that is?
It
CSF?
could be. I'm not sure in what context you're referring to it.
Well, how about if there's a massive leakage of CSF from her nose? What does that tell you as a doctor?
It could mean that there's a skull fracture.
Good
Did you
morning, Miss
notice
Diane.
any clear fluid coming from her nose?
I did not.
Is that something you would look for?
Yes.
How quickly do you get the results of the x-rays when you're in the emergency room?
Well, these were CT scans, but fairly quickly in a trauma.
I'm sorry, CT scans, x-rays. So you had CT scans that were able to show you the damage to her neck and upper chest. Is that right?
Yes.
And what did those CT scans show you?
Yeah, Matlock.
Well, what I remember is a thoracic spine injury.
And when you say a thoracic spine injury, would you agree that the top part of your neck, your throat area would be cervical, right?
Correct.
And that's when the numbers go C1, 2, or whatever they are. That would be the actual vertebrae in the cervical area of the upper body, correct?
Yes, the cervical spine.
Okay. And then below the cervical spine would be the thoracic spine. Is that correct?
Correct.
And the thoracic spine would be, and sometimes they're delineated as T1, T2, meaning thoracic 1, thoracic 2, all the way down to what, 5 or 6?
12.
I'm sorry?
12.
12. So when you looked at, and the lower portion would be the lumbar. Is that right?
This guy.
Now, when you looked at the CAT scans, did you determine
She's like,
the
no.
extent of the injury
12?
to the spinal cord?
I could determine the extent of the injury to the bony thoracic spine.
Okay, what was that?
I don't recall exactly the level.
Yes.
I would have to look at the report.
What does that
This
mean?
right
The
here.
level of the T?
Correct.
Was her cervical spine injured?
I don't recall. I'd have to look at the report.
Were you aware that her thyroid was crushed?
I don't recall.
Do you know that
Are
her
we froze on
cervical,
YouTube?
Spine vertebrae was fractured,
Hold on.
destroyed?
I don't recall.
Hold on,
Doesn't
my
that
face is
control
frozen
a
on
person's
YouTube, and I
breathing?
look
Does that have anything
delicious.
to do with breathing?
Hold on a
It
minute.
can.
What do you remember about looking at the damage to the spinal cord depicted on the CAT scan?
What sticks out most in my mind is her thoracic injury.
Okay, and what was the thoracic injury?
I don't recall the exact level.
What does it mean by effect level?
The exact level.
I'm sorry. Were you aware that there was a complete transection of the spinal cord on T5 and T6?
I'm sure I was aware at the time, yes.
Okay. And just, can you tell me, what does it mean when it says a complete transection of the spinal cord at a particular, apparently that would be at thoracic 5 and thoracic 6, right?
Mhm.
What does that mean with a complete transection?
It means
coming
the bones
back.
are no longer one on top of the other. They're moved apart.
Were you aware that there was a significant edema noted in her chest?
If that's what the report says.
Okay, and what is edema?
Swelling.
And does it also refer to fluid?
It can.
Did it refer to fluid in this case?
I'm not sure. I would have to read the report.
So in addition to the edema that was noted, was there edema noted around C7,
Cool
T1,
Medina.
T2, T3 to T4?
Again, I would have to have the report
back.
in front of me.
When you noted her base temperature as
I'm
being
unfrozen now.
82 degrees, what does that tell you as a doctor?
It means that her body temperature is lower than normal,
And what is normal?
98.6.
And if a person goes from 98.6 to 82 degrees before you place her in the bear hugger, what does that tell you? Does that affect the body at all?
Yes, the body works ideally at 98.6. So anything outside of that range, not ideal.
To what effect, as a doctor? What effect, if any, on the body if a person has an 82 degrees base temperature?
The list of things that could go awry is quite long.
Can you give me an idea, maybe
What
the
is
top
he?
three?
What is he trying to prove here?
She could have a metabolic derangement,
What's a metabolic derangement?
meaning her body wouldn't be processing things the way that it was before. Her cells are not working the way that they should because it's too cold.
Would you agree with me that when you were looking at the injuries to the wrist, and
Oh, I've
to
been
the,
listening.
both wrists actually, you noted lacerations in the volar aspect of the wrist?
Yes,
What is a volar? What does that mean?
it's the anterior aspect of it.
Interior? Okay, thank you. Would you agree that on both wrists there was deep laceration?
No, I get that hooked, but
wouldn't
I don't
characterize them as
think.
deep.
You would not? And when you made reference to her being transferred to a tertiary
That-
care center,
the-
what does that mean?
To
It
me,
means that it's a
the
hospital that
cuts
has
is
more
a
services
direct.
and specialized care than we do at our
The
hospital.
the cut
Now,
is a
when she was at
direct
the South Shore Hospital,
um,
counsel
result.
asked you about
I mean,
whether or not
the
you
body
noted any
temp. Let me.
injuries
Okay.
to her
To
head.
me, I guess
You
what
did
went
not
through my
notice
head when I
any,
said that is the body
bleeding
temperature
or
being
scrapes or
82
bruises of
degrees
that nature,
is a
right?
Not
result
that I recall.
of her cutting her wrist and
Did you
jumping out
notice
the
any injuries
window.
to her
It is
lower
not
body,
a
her legs,
foretell
her feet, let's say
of
her feet
how
or her
she tried
buttocks?
to kill herself. It's a
I don't
result
recall.
of the actions that she decided to take. On the cuts,
At
listen,
any
I don't
time while
know.
she
On the
was at
cuts, I'm
South Shore
thinking she knew.
Hospital, did
On
she
the jump,
have
I'm thinking
a
she was
cardiac
done.
arrest?
So, yes, she did try to
Not that I
take
recall.
her
You
exit
know,
the
she
earth
had
of
a
her own
cardiac
accord.
arrest when brought to the
But
Boston Hospital.
Did not know that.
I guess that's why I don't understand
How about
the testimony of how
Was there any blood
cold or hot
transfusion
the
at South
body
Shore
was,
Hospital
because all of the things that
Medical
happened
Center?
prior
I
to
don't
that
recall.
moment happened.
You aware that she
And
had
it's
a
already
massive
set in
transfusion
stone.
of blood once she hit
We're talking
Brigham and
about cause
Women's?
and effect here,
No.
but
What does that
really,
tell
we
you?
know what
Massive
happened,
transfusion
don't
of
we?
blood. What does that mean?
I couldn't comment on why they gave it to her.
Were the police in the hospital when she was there with you?
I don't recall.
Was she chained to the bed by handcuffs?
I don't recall.
Go ahead.
You redirect?
Very briefly.
Thank you, Drew Taylor. You can get all your
I'm gonna
merch at
give you
scfmerch.com.
your notes, if that's okay.
Sure, thank you.
I'm gonna just take a look at it and then take your time and just look up when you're done.
Well, I mean, to me, it's kind of like saying, Sambo had a heart attack. Well, okay, let me come up with a better example here. Sambo
Okay. You need this
You
one.
wanna just,
cut
flip these
his
around, to see if that
legs
makes
off.
sense of the note that you had in the record.
Therefore, you're going to testify about him bleeding out. Well, the bleeding out was because he cut his legs off. Her body being cold is a result of her direct actions, not an indication that she really tried to unalive herself, because she can't control that part. She can't control her body temperature. It's a cause and effect argument, and it's, to me, and not a indication of proof or guilt that she really tried to take her life either way. If I was on the jury.
Thank you.
Now, counsel asked you on cross-examination about pupils, right?
Mhm.
Was there anything notable, according to your now review of the notes, about Lindsay Clancey's pupils?
No,
So what did that tell you about a possible head injury?
it just indicates that there's no
Yeah,
obvious
thank God,
injury
D.
or brain herniation.
I'd be showing my
Now,
true time
you
card
indicated
saying,
that she
honey, don't
was,
let me in.
somewhat unresponsive, but her eyes were open. She was nonverbal, correct?
Correct.
Did you observe her to be moving her arms around at various points?
She did move her arms on exam. in response to painful stimuli.
And as far as the intubation goes, you're aware that she was in fact sedated in order to maintain intubation.
Again, I'm not certain of that because I was not the one who performed the intubation.
Okay. And you were asked about CSF. Having now kind of looked through your notes with your interaction with this patient, was there any note of cerebral spinal fluid, in either your assessment of them or your review of any of the CT results?
I didn't see any mention of that in my physical exam.
Now, as an emergency department physician, you're not treating all of these spinal injuries, correct?
Correct.
Your focus is to assess, stabilize, and get them where they need to go, right?
Correct.
And so that's what you did with Ms. Clancey.
Correct.
When the injuries that were described as a volar aspect, counsel mentioned that terminology to you, right?
Yes.
You've now on direct examination identified those injuries as superficial. What characteristics make you say superficial?
Because I wasn't able to visualize any active bleeding or muscle tissue or injury to tendons.
And is it fair to say that oftentimes patients that come into the emergency department might be, if they have some sort of injury to their spine, you don't want them to move, right?
Correct.
So they might be at some point kind of either put in soft restraints or restricted.
The goal
on
has been
bed.
changed to
Correct. Thank you.
cow being beamed
there
up
anything
into a
further?
spaceship.
All right, thank you, Doc.
Thank you.
Please send one if you can. You guys to support the platform and what I do here. If you can't, tapping is clapping, sharing is all those things. We have 21,000 likes, 314 souls in the room. If you're just joining us, we're talking about the Lindsay Clancey trial and listening and watching it together. I'm going to challenge you to get 50,000 likes. Thank you, guys. We are also live on YouTube. If you want to watch it with us, 21 souls on YouTube at Steph's Case File, same logo at Steph's Case File. Thank you, Mama Lou.
Good morning. Do you solemnly swear that the testimony you give may be true and the matter now pending between the Commonwealth and the
Dee Dee, we've been wondering the same thing. Like, what could have happened? So I said, somebody, something's happened.
Hey, good morning.
Good morning.
Morning. All right, Attorney Buckingham, please.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name?
Rose Stoffers,
Could you spell your last name for the record?
Stoffers.
And what do you do for work?
I'm a sergeant on the state police in the crime scene services section
And how long have you worked for the state police?
since January of 2019.
Can you tell us a little bit about what the crime scene services section is of the Massachusetts State Police?
Sure. So we get called to all different kinds of crime scenes. Our main job is to document the scenes with photos and videos. We can also process evidence on scene, or we collect evidence and bring it back to our lab and we process it there. We're processing for fingerprints, and then we do fingerprint analysis, try to identify any fingerprints we find on the evidence.
Thank you. Thank
And
you,
fair to
Tanya.
say
That's so
that state
cute.
police
It's so
crime
cute.
scene services have labs across the state, right?
Correct.
Crystal
And what,
sent
office
2
do
jewels.
you work
Thank
at?
you, Crystal.
Right now I work out of the Boston office.
Going
Thank
back
you,
to
Crystal.
2023,
Thank
were
you,
you
ma'am.
working out of the Lakeville office?
Yes.
And so fair to say the troopers that are out of that Lakeville office do respond to a lot of scenes here in Plymouth County?
Correct.
I'm going to draw your attention to January 24th, 2023. Do you recall being called out to the South Shore Hospital in Weymouth on that night?
Yes.
And do you recall approximately what time you arrived there?
I arrived at about 8:35 p.m.
Were you by yourself or were you with anyone else from the unit?
I was by myself. I met then Trooper Lawler there. He's from the Plymouth Detective Unit, and I also met the forensic scientist there.
And can you explain to the jurors a little bit about that relationship that you as a trooper have with forensic scientists that work for the lab?
The forensic scientists are civilians who work for the lab, but they will come out to scenes as well. They do mostly testing of like biological evidence that we don't do. So we work closely with them both at scenes and they share our office in Lakeville.
And fair to say that they're actually part of a different unit with the State Police Crime Lab called the Crime Scene Response Unit.
Correct.
But oftentimes is it the case that when you're responding to serious crime scenes like this one, that you're working in tandem with a forensic scientist from that unit?
Yes, that's correct.
Okay. And so in this circumstance, you indicated that Maureen Hartnett also was at the South Shore Hospital with you?
Yes.
When you got to the South Shore Hospital, what was the purpose for you being called out there? What were you asked to do?
So my instructions were to document the defendant, any injuries that she had. Forensic scientist Hartnett was going to be taking swabs, and anytime they take swabs, we have to document the areas in which they swab.
So when you got to the South Shore Hospital, do you remember where you went in the hospital?
Yeah, I went to one of the trauma rooms in the emergency department.
Okay. And so were you able to make observations of Lindsay Clancey?
Yes.
And do you see Lindsay Clancey in the courtroom?
Yes.
All right. Record may reflect the identification.
Thank you. What were your observations of her when you saw her?
She was covered in like blankets and like heating devices, and she had a neck collar on. So when I first walked in the room, I couldn't see anything on her body because she was under the blanket other than like the neck brace and her face.
May I approach?
You may.
Show you a photograph. Is that a fair and accurate representation of how you observed Lindsay Clancey?
Yes.
So this as the next exhibit, please.
Any objection?
I have no objection to any of the photographs.
All right. That may be admitted.
Oh, I forgot to unmute myself when I had to go through my menopausal fan moment. Anyway,
Can you see that from where you're sitting?
Yes.
Mr. Gray's
And
in the
so,
house.
This blanket,
And then I
that's
said,
how you
"Good
observed
day,
her,
mate."
in the trauma
And then
room.
Queen come
Yes.
in and I said,
At some point,
Queen.
did you and other medical staff remove the blanket to document injuries?
We didn't remove the blanket, but we did remove her arms out from underneath the blanket.
Okay. And so were you able to do that on your own, or did you need assistance?
I needed assistance.
And why did you need assistance?
When I first attempted to pull out her right arm, she was uncooperative and pulling it back and fighting against us a little.
So did you enlist the help of the nurses to help you to remove her arm from the blanket?
Yes.
Were you able to make any observations of kind of the temperature in the room at the time that you got in there?
Yes, it was very hot in the room.
Okay. And that blanket that you observed, were you aware that blanket was to kind of bring her body temperature up?
Yes.
Willa-doodle, I'll see you.
When you were able to view her arms, when you first saw them, did they have anything on them?
There was a red-brown stain on her hands, and there was gauze on like her wrist area.
Did you enlist the help of the medical staff to remove the gauze?
Yes.
And why was that?
To document any injuries that might have been underneath.
And were you able to observe injuries?
Yes.
In addition
Oh,
to,
no, Willow.
well, strike
Hope
that.
you're
The
okay.
injuries that you observed or the areas of the body that you documented, what were they?
I documented, I took that first overall photo of her. I took a close-up of her face and the neck area that I could see. I documented both her hands, both sides of them, her wrist area underneath where the gauze was, and then the nurses assisted in opening up the neck brace, and I took photos of her neck as well.
And in addition to documenting the defendant herself, did you document any other items that were at the South Shore Hospital that evening?
Yes, I documented any personal belongings that were brought in with her.
And so you're aware that they removed clothing from her?
Yes.
And so you documented the
Oh,
clothing?
no,
correct.
Willow.
And that she had 2 rings?
Yes.
And that you photographed those rings?
Yes.
And you're aware Trooper Lawler had retained those
I'm so
items?
sorry to hear that.
I'm
I hope
not sure
it's-
who retained them from there.
Okay.
everything's
But your
okay.
role was just to document them?
Correct. I didn't take anything.
In regards to this particular, well, go back for 1 second. In the crime lab, how does your unit or how do you identify particular cases that you work on?
As in like being called out to something?
Well, is there a way that you, once you get called out to a case and do work on a case, is there a way to track what you did with each case by some sort of case number or lab number?
Yes, we have a case number associated with it.
And as far as lab numbers go, you're aware that the crime lab follows pieces of evidence using the same lab number.
Yes, that's correct.
And does that track items that go through your system?
Yes, it. So our lab number goes into a computer system and it tracks everything. It keeps every report written on that case. It tracks the custody logs. It tracks every piece of evidence that's been involved in the case.
If it helps you, there's no issue as to chain of custody or foundation or anything like that.
All right, thank you.
Thank you. Other than going out to the South Shore Hospital on January 24th, do you recall being called out to another location later in relation to the same lab number?
Yes,
And that would have been on January 6th, 2023?
February 6th.
Or excuse me, February 6th, thank you. So where did you go?
I was called to the Plymouth Detective Unit's office in Brockton.
And did you meet or speak with one of the troopers from that office?
Yes, I did. Trooper Rabbit.
Trooper Rabbit. And what did he ask you to do on that day?
He asked me to photograph a bag of medication and some documents that were inside that bag that had been brought to their office.
I don't know if I could be took serious if my last name was Rabbit and I was also a
Did you do anything else with
detective.
the items that Trooper Rabbit had in his possession on February 6th?
No, I just photographed them and left them with them.
Okay. And again, is that something that your unit sometimes is called out to do?
Yes.
Nothing further.
Attorney Reddington?
So, is it trooper? Are you a chemist or
Sergeant.
sergeant? Sorry. Sergeant, you had a search warrant apparently when you went into the house, I guess, with Trooper Rabbit.
Now
I didn't
who's
go into
not
the
reading
house.
their
Oh,
notes?
so he just gave you the bag. In other words, you didn't go in the house and take pictures of any of the rooms or anything like that.
No, the bag was at their office when I went to their office.
Oh, okay. All right. That's all I have. Thank you.
Anything further, Attorney Buckingham?
No, thank you.
All right, thank you, Sergeant.
Thank you.
Thank you, Miss Cheryl.
Yeah, please.
They are dismissing that witness, but they have approached. They may be wanting to take a break right about this time, or I'm not sure what's going on or what the sidebar is going to be about. But what do you think so far? Oh my goodness, 28.6 thousand likes. I'm going to challenge you to get to 273 souls in the room.
At this point, so I'm going to ask you to go back. We'll get you back in here in a short while. Okay, thank you.
Court, all rise. Sure. People of the notebooks. There's money says.
They are taking a break. All he said was a short while. Oh, are they going to be discussing something? Hold on. Because this is not looking like a break to me.
All right, so we'll be in recess on this matter at this time. Thank you.
Okay, recess. We don't know how long, so we will just leave that right where it is. You don't know how long recess is going to be, and neither do I. But what are you thinking right now when it comes to where are we at so far? If you are in here, we have 353 souls. What is your personal opinion on if you were on the jury right now, given what you know so far, what would you what are you thinking? don't hear nobody. He is guilty? He who? Halloween says insanity. Jennifer, sanity. Not guilty by way of insanity. Lindsay, insanity. Where? We have been talking about this case since the beginning. And now all of the Patrick haters have come to the show this morning, right here. They're all in this room. Insanity. Unbroken is on the fence. Sandra thanks the husband. That's 1, 2, 3. That's 8 people I've counted to come in here this morning to say that. 8, 9. Okay. Let me see. If you think Patrick is guilty and Patrick done this, say Patrick guilty. Comment those 2 words, Patrick guilty, in the comments. Just let me see how many of you are in here right now. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. $18, 19, 20, 21. They're 22. Yeah, let's do a poll. I thought there were going to be like the 8 people comment. That is crazy to me. All right. Give me a smiley face if you think Patrick is guilty. A crying face if Patrick is not guilty. Smiley if Patrick is guilty. Crying if he is not guilty. Uh-oh, we're kind of neck to neck on this in here. Wow. 32. Patrick is guilty is definitely winning. That's wild. I haven't even considered him. Look at that. The poll ends in 2 seconds. 37 is the winner of people in this room right now. A lot of people just listen. But for those who are, like to comment and things, that's a lot. Okay, yes. So people in the comments who think Patrick is guilty, say no. Well, what I mean by guilty is, do you think Patrick strangled all 3 of the children? Not that he's guilty that he sucked as a husband, or that he let this medicine fiasco go on, or that he was a cheater. Because I've seen, I don't know. In some ways, but but you can, it was her hands though that went on their necks. The reason, Harley, is because people were coming in like, no, it's Patrick. And I'm taken back by it because I haven't heard this theory so far. But why would she, Allie, do you think, would let, okay, so if you're saying that Patrick did it, then she let him, or not let him, but are you saying that he pushed her, he cut her wrist, and he cut her neck, and he pushed her out of the window? I've not heard it either. Mhm. So this time he was at CVS and the restaurant was before or after? So did he do all that and then run to get food? I'm holy camoly. I don't think he was involved. You might can disagree. I mean, you're free to disagree with me. That's what this show's about, is seeing everybody's different opinions. But I don't think he cut her or pushed her or strangled the kids. That's what I was saying earlier, Grace. It's not the end of the trial now, nearly. But what is more likely than not? Where's the blood on his clothes and stuff? Did they look at that as him trying to save her in the ground? I mean, because if he's upstairs cutting her throat, if he did that, there would be blood on him in such a way. Like I would have been like they have been investigating this for years. Not, and I'm not talking about us, by us, TikTok conspirators. It's been investigated by trained professionals. And we're at the end of Lindsay Clancey trial, and everybody's saying Patrick done it. But how did he not go so far? Did he know how deep allegedly to cut this if he's the one that done it? But why would she take the fall for the whole thing? Why would she do that? 400 souls in here. If you're in here, please hit the follow button. It's right by my name. It's right there. Hit it. It's totally free to do. So you can keep up with this case and this conversation that we're having. I don't feel like he did it. They, I know some investigations are, bleh. We don't trust them. And I'm sure all agencies do something wrong. But for the most part, I think they got this investigation down here. Ashley on the Big YT is saying she's guilty and should go to prison. People on the TikTok are saying, no, wait a minute. Patrick Clancy is shady as hell. Hmm. Thank you for your follow, Sydney. Kayla, I just don't, I look at things so analytically. Perhaps he did use her, but I don't think he killed them kids. After the ER doctor, they had the sergeant of the police department testify about how she was taking pictures and just the all the steps that sergeants do. But Chris Watts shoved his kids in there. He didn't shove his kids anywhere here. She strangled them out. And it wasn't him, it was her. Trying to compare apples to pears here. I'm just saying, I don't think he had anything to do with the actual. Now, I don't know nothing about their marriage. I don't know if, I mean, there's always divorce, but I don't think he done it. I mean, I don't think he had anything to do with it. We're on break, Melanie. Yeah, they took a break. I think first usually we'd have to prove when he met his mistress, and then you'd have to prove that she even was a mistress. We can't listen to the 911 call, but if you could and you can hear the emotion in his voice saying she killed the effing kids, would you change your mind? Because it seems to me, just by reading the transcript of the 911 call, that it was a chaotic scene, like he was sincerely in shock. Would I've heard conflicting on whether or not he was to leave her alone, but I'm going to tell you right now. Now, if you want to believe he had a physical part to do with it, I completely we're not on the same page, and that's okay. But I don't believe he would intend for his children to be dead, regardless of whether or not there was a mistress or a girlfriend or whatever. I don't think he would have intended her to be dead. Rebecca, I see you. Welcome over on YouTube. No, I just can't. And it's not that I look at him and think, well, boy, he looks innocent. It's just that, well, he didn't call them. He said, oh my God, she's killed the fucking kids. That's not calling them that. That's just a statement of shock. Like, I can't believe this happened. But I'll tell you this part though. If my spouse looked at me and said, I feel like I want to kill the children, there would never be a time ever again that they were alone together. Yeah. I don't know why he decided to. Christy, thank you for the hand heart. I appreciate that. So that part, I don't know why. I don't know why he would have chose to go out for food and non-critical medicine, I would say. No, I don't know where he was on the during the day, but I'm just saying, just in general, even if he was, I mean, there would be, well, first of all, I would have called 911 because when you are in harm to yourself or someone else, you get committed into psychiatric hospitals that do not help you. But that's the way American systems are. So we should have admitted her and overly paid doctors to do nothing ever. That's the way every psychiatric hospital is. I wouldn't have said, "Oh, I'm going to go get a bowl of food from," and then I'm going to, and then I'll be right back, everybody. Hell to the no. Throw down. Everybody's getting in the car with me. We're all going to get the food. But hindsight is 2020. It's easy for us to say that. But the first words that come out of your mouth about harming kids, honey, the cops is going to be here. Husband, wife, nothing. Your job is to protect the children. Do you feel he done enough to protect his children? Let's say Lindsay Clancey is going through that it's up to you whether to believe that she done this maliciously or that she was under some sort of psychosis from the adverse effects of all of the medicine. That's up to you. But do you feel that he did enough? Everybody's saying no. I don't think he did. I don't think he done enough. Your job is to protect your children at all cost. All of them. That means not leaving them alone with somebody who has thoughts of killing them or fantasizes about them all dying with some mysterious illness. But he didn't physically kill them. He didn't push her out the window. He didn't cut her neck or her wrist. She did that. First, the kids. Yo, I don't care. You can think whatever you want, honey. I'm telling you right now, children are special to me, and I will cut. Okay. I know that's his wife, and he had a duty to protect her too from herself, most of all. But so I would have to have separated the situation here. Until everybody got straight. You get me? I'm taking the kids. I'm going to mom's. I'm taking the kids. I'm going to a hotel. But I'm calling help for you, but I'm going to separate myself from you because you just said you wanted to kill our children. Or you're having thoughts of it, intrusive thoughts. But didn't he work from home? I'm a little bit confused on the timeline. Did he work from home? Some are saying yes and no. I thought that he did because he's like, this is my office. I've been working from home. Da, 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 da. He was working from home at that time. Well, he said that she played in the snow with him and everything seemed fine. But so if you're saying that Patrick is responsible in the ways, I don't think he's responsible, okay? You can try to help somebody, but the decision is going to come down to that person, right? If they're going to do something to themselves, they're going to do it. But it doesn't mean that you cut their wrist and then you are the reason. He might be a adulterer, a sucky husband, all of those things, but he's not a murderer, as some of you have come in here and pretty much said. Sarah says, I think he could have done more. If she was that bad mentally, he should have been more aware. Well, honestly, Bailey, I see you. I've been seeing you a couple times. I just want to say, hey, Bailey, with the weird neighbors. I just wanted to say one thing about this, though, and this is my opinion, but I feel like the jury is going to come back with guilty by reason of insanity. Christy, thank you. I think they will. I think Lindsay Clancey is going to be just fine. Nice and comfy in her psychiatric hospital. But it doesn't bring the kids back, does it? Do you think it will invoke change in the way that postpartum is considered and medications given? And how do you think, really, that the doctors could have kept in contact with each other and stayed? I mean, what happened here? Where was the disconnect? Well, I don't know. No, they're just on break. I don't know when they're coming back. It's too early for a lunch break. Might be mid-morning break. What do you think about Lindsay playing in the snow with them, with the children that morning, and having a good time? Because the jury's going to have to consider a couple of things, and one of them is, did she calculate it? The calculation of the route. Because what is the definition of psychosis? Let's think about this. Today's goal, by the way, is 10 of these hand hearts. If you can throw one, it goes to support the platform and what I do here. If you can't, obviously, tapping is clapping, sharing, and all of those things. Hello, Queen. Thank you so much. Okay. So, and I have been in psychosis. Thank you, Christy. Thank you. Thank you. I appreciate that. Not to bring up my personal stuff, but I have been in that sort of mental state before. But psychosis is a mental state marked by loss of contact with reality, defined primarily by hallucinations, delusions, and disorganized thinking. It is not a disease by itself, but a symptom of underlying conditions like schizophrenia, bipolar disorder, or severe stress. But she had the wherewithal, right? She had the sense to say, go to the store, go get my medicine, go get us some food. So are you active in during psychosis enough to say, to put all that up? Do you see what I'm saying? You can be. And take a phone call. It is hard to mask psychosis. I don't think you can. You can't. Because once you click over, it's a click. I'm going to say a click because I've been through it. And I can look back and say that was a psychosis moment because I don't remember that whole entire day. It's a different road of reality. Mm-hmm. Right, and claim. That's what I'm saying is when you're in a true psychosis, you are, I don't know how, for me, just laying in bed, I guess, not knowing where I was. Right, but then you answer the phone. Postpartum psychosis is a severe, rare psychiatric emergency affecting about 1 to 2 in 1,000 mothers after childbirth, characterized by a sudden loss of touch with reality, hallucinations, and delusions. An acute and severe mental health condition causing a profound break from reality that typically develops within the first 2 weeks after delivery. The baby was 8 months old. It's different from the normal baby blues or standard, postpartum depression due to its sudden onset, psychotic features, and dangerous nature. To me, this was not, it couldn't be a sudden onset of psychosis because she was true ass planning and functioning through it. And it's too severe to just be the baby blues. That's my opinion. But I think the jury's going to see it a different way. I think they're going to see the doctors and medications. I feel like this is going to be by way of insanity. But in my personal opinion, looking at the facts, I don't know anybody that has went into a psychosis so deep that they completely plan and function and then kill their children. Usually not. Eight months later, Lordy day, honey. Ray, you need to go over and sit with the husbands did it section. We've got one, trust me. I think it's the planning part that I get stuck on. Katie says, especially with all the med changes, I can completely understand that as someone who has withdrawals. Come on. How did he do it? Do you mean he had a part in it? Or, I mean, like he physically done it, or he was a second husband and therefore it led to this? Right, but did he do it? Who done it? Who laid the children down? Thank you, Christy. And looked into their eyes. And they looked back at somebody who they trusted, fed them, loved them, and watched the life drain out of their bodies. Who done that? I haven't heard it until today, Katie. We've been covering this a hot minute. "55 minutes," Lex says, "to tie 3 knots and jump." Sarah, I don't remember if she did it. Did she have postpartum with any other kids? I don't remember that being brought up. So I can't answer that part. I don't remember. Exactly, Sarah. They don't need to put her out on the streets to reprocreate and do this again. You should have it with all children. Well, he said not particularly struggle after every baby, but struggle when it was time for her to go back to work. I do remember that part, that everything was fine when she was on leave, like everything was fine. They went places, they enjoyed their life. Patrick testified to that. Cheryl, good to see you. Oh, I'm sure. The husband usually is the first person they look at. So I'm sure that they looked at him and cleared him, and all that's been verified by professionals. Right. It can be, I've had 2 children. They're grown adults now, but I remember going back.
Your Honor, for the purpose of the record, we return back to the matter of Commonwealth versus Lindsay Clancey. All parties are
They
present, including
coming
the
back to
defendant,
court.
excluding the jury.
All right. Counsel, we ready for the jury?
Yes, Your Honor.
All right.
While we're getting ready for the jury to come in, please throw some cows getting beamed up to the alien ship. They're very cute, and it does go to support the platform and what I do here. 47,000 likes. I'm going to challenge you to get to 75,000 likes. We have 385 souls here, and we have 16 souls over on YouTube. Thank you. Oh, thank you, guys. Seeing it so cute. That's very cute. That's a good one. That's how I feel today. I'm a cow being beamed up into a space station.
All right.
That's cute. That's very cute. Thank you for sending that, Christine. We are listening to the Lindsay Clancey trial. They just come back from a break. Probably a good 30-minute break at least.
This court's now in session. Be seated, please.
Laundry days every day for
We
me.
return back to the trial of Commonwealth versus Lindsay Clancey. All parties are present, including the defendant and including the 18 jurors.
All right, thank you. Commonwealth, call your next witness, please.
Your Honor, Commonwealth would call Rochelle Amity.
Michelle Amberty. Thank you, kitten. Thank you for sending one. They're very cute. Oh my gosh, Christy's throwing down on the cows going up. Bye. Bye, cows. Boo. Thank you. Thank you, Christy.
Please.
Hey, good morning.
Good morning.
Inquire?
Yes, counsel, please.
Thank you. Good morning.
Morning.
Could you please tell the jurors your first and last name?
Rochelle Amity,
Do you mind spelling your first name for the record?
Rachelle. Last name is Amede.
Rochelle, not Michelle.
And how are you employed? What do you do for work?
I'm a nurse at Brigham and Women's Hospital, the trauma surgical ICU.
How long have you been a nurse?
Almost 27 years.
And can you tell us a little bit about your educational background?
I have a bachelor's in nursing from Salem State University.
And how long have you worked at Brigham and Women's?
Thank you, Christy.
20 years this week.
And which unit did you say you worked in?
The trauma surgical ICU.
How long have you worked in that unit at Brigham?
8 years.
Going back to January of 2023, were you working in that same unit?
Yes.
And what was the shift that you normally worked?
I work the night shift, which is 7 p.m. 7 a.m.
And what was your schedule like for any given week? Did you work back-to-back shifts or?
I can sometimes work back-to-back shifts.
Okay, but you always worked the night shift?
The night shift.
Okay. I'm going to draw your attention to a particular patient that you had some interaction with in January of 2023, and that was Lindsay Clancey. Do you recall treating her?
Yes.
And was she in that trauma surgical intensive care unit?
Yes.
Do you remember the first time you interacted with her?
Yes, I got her.
And would that have been on the first night she was there on January 24th?
Yes.
How did she come to your unit?
Thank you,
at the
Christy,
Brigham?
for steady on
She
the beam.
came, from the emergency room, went to MRI, then came to the ICU to me.
And were you aware that she had been seen at a local hospital
Yes.
in Weymouth, the South Shore Hospital?
South Shore.
While you were treating her on that first night, were you the main nurse assigned to her care?
Yes.
And what were your responsibilities as the nurse assigned to her care on that first night?
First night, she was intubated, came to me intubated. We had to maintain her blood pressure at a certain number. Just care, regular nursing care.
Thank
Okay,
you.
and were you aware that she was on what's called a one-to-one?
You're very much appreciated. Thank you. I
Yes.
appreciate
What
it.
does that mean?
That means patient usually can't be left alone, and also depending, you always have to have somebody outside the room with
Thank you.
to monitor the patient.
And is that
Thank
because
you.
that patient has been identified as a potential suicide risk?
Yes.
Now, on that, the 24th into the early morning hours of the 25th, was there a particular event that you were witness to for this particular patient?
She coded.
What does that mean?
Means her blood pressure dropped for her. It meant her blood pressure dropped and it wasn't sustainable with life.
So what did you do when her blood pressure fell and she coded?
We started CPR, we did compressions.
And this event occurred approximately at 3:30 in the morning, correct?
Yes,
Was she eventually stabilized after that code?
she was.
And
Thank
did
you,
they do
Christy.
something as far as intervention to try to maintain her blood pressure?
We increased her pressors. We added.
Are they
2 more
saying
pressors. She was
Lindsay?
already on 2. They placed
Flat
test tubes
line.
in, started what we call a massive blood transfusion
Thank you.
protocol.
And did this all occur in the trauma surgical intensive care unit, or did she have to be taken to a different
No,
unit?
it all occurred in her room.
That's interesting. I didn't know that
And
part.
other than medical
I didn't know that
staff
part.
that was treating her that particular night, did you observe anybody else present?
She had 2 police officers outside the room.
Okay, and so did they remain outside the room for the duration?
Always outside the room, yes.
As far as your interaction with the patient on that particular night shift, was she responsive at all during the
No.
time that you saw her?
No.
And with intubation, you mentioned she was intubated. Is
Look at
a
the
patient
donuts.
often sedated in order to maintain
Thank you.
intubation?
Yes.
Why is that?
Helps them not fight the vent, breathe better, and make sure that they're comfortable.
And what does sedation do to an individual?
You're calmer, you're sleeping,
Makes them more relaxed?
relaxed, yeah.
Other than that night, that first night, the 24th into the 25th, did you have the occasion to treat this patient at other points within that week?
Yes, I have.
And I'm going to draw your attention to January 26th of 2023. Do you recall interacting with her on that day?
Yes,
And is it fair to say that on the 26th, she was still intubated
she was.
and under sedation?
Yes,
Well, during this time period on the 26th, was she arousable, meaning could you initiate some communication with her?
some, yes.
And were you able to kind of give her commands in order
Thank you
to
for your heart
care
maze,
for her that
too.
she was able to follow?
Yes.
And when I say
And-
able to follow, obviously,
Simple.
Please
yeah,
follow me if
commands.
you're in here.
Well,
Hit
what
that
kinds
button right
of,
by my name if
Squeeze
you've
my
not done so. It's
hand,
totally free
you
to
wiggle your
do.
toes, just basic neuro check to just make sure she's alert and she's able to follow, understand what you're saying to her.
and for this particular patient, you're aware that she presented with a spinal injury, correct?
Correct,
And so movement of the lower extremities was not something that she did.
correct.
But did you observe her to move her head around and move her arms around?
Yes,
Now, you also had the occasion to
I'm
treat
not
her in the
done.
overnight shift of January 28th of
I'm
2023,
not
correct?
done.
yes.
And during that time, she was also still intubated.
I believe so. I'm not sure.
Thank
I've had
you
both
for
intubated
that.
and-
Thank you, Wisconsin
Okay,
mama.
while
Later.
I was talking to my
while
dog.
she was still intubated, did you have a system that you could use to communicate with her?
It is
Um,
live, Sophie. It is live.
Yes, board. We have a whiteboard or clipboard that sometimes patients can write
Thank you,
on.
Christy.
Did you
Again.
observe her
Christy,
to utilize
again, you
that
guys are
whiteboard to
being
write on it?
rock
Yes.
stars.
And at this point, when she's writing on the board, her eyes are open and she's responsive.
Yes,
And she's able to tell you how she's feeling, correct?
yes,
And fair to say she used that whiteboard to tell you she was confused and that she couldn't feel her lower extremities.
yes.
And do you recall her complaining of having pain?
Sarah, I know,
I
right?
don't recall.
During this time period on the 28th, do you recall whether the patient was placed into restraints?
Yes.
And why was that?
Well, we restrain all patients that are intubated for safety,
And why?
so they don't pull out the tube or pull out any lines that they have.
Okay, and so as they're not at that level of sedation anymore where they're just completely asleep, there is danger
I agree,
that they
Christy.
could move
It's
and
very
cause damage
important.
to-
Medical equipment out of the way.
Okay. And so in this case, as far as the restraints go, fair to say that they were soft restraints.
Soft, yeah.
And what does that look like for a patient?
Meaning
Well, like how do you, what does a soft restraint look like?
a
for
soft
those of us who don't
restraint,
know?
it's like maybe I would say a cushion restraint, and then it's tied to the sides of the bed. So it's all the way around your wrist.
Okay. At some point by the end of that shift, you recall that she was extubated.
Yes.
Can you tell us what extubation is?
That means you remove the tube. You usually
Thank
stop
you,
all
Christy.
sedation.
You're sending me a candy bouquet.
And were you able to make observations of
I love
the
it.
patient once she was
Thank you.
extubated?
Yes.
Did her presentation change at all from your previous interactions with her?
No.
Did you have the occasion to treat her again on January 30th?
Yes.
And again, at that point, she has already been extubated. And are you able to then make an assessment of her without the tube in about her orientation and her alertness?
Yes.
Is that something that you kind of do each and every shift?
Every shift, yeah.
Was she still on sedation medication at that time?
No.
And what was your observations of the patient's demeanor now that she's extubated?
She's flat. No emotion either way.
And is that fairly consistent with what your observations were of her during the course of your time treating her?
Yes.
How about
So when
being
she
alert
was
and
awake,
oriented?
she
Did you
had no
observe her to be
emotion?
alert and oriented?
She was.
And did you observe her to identify sleep as an ongoing issue?
Yes.
And so as part of the plan for treating her, did you address the sleep?
Yes.
And how did you guys address sleep?
The plan was to start the first sleeping medication for her. I don't remember exactly which one, and then wait a couple hours, see if it worked, and if not, try another medication.
Okay, and this actually occurred over the course of a few days.
A few
correct?
days. Yeah.
During the time when you observed her to be flat, as far as her affect goes, did you also observe her to be cooperative?
Yes.
Meaning she followed your directions?
Yes.
Did you treat her, or were you the overnight nurse for her on February 2nd? You recall?
Yes.
On this particular night, February 2nd, do you
What's up,
remember
James?
her making a particular request of you or ask you for something specific?
I think that was the night she wanted to reach out to her lawyer.
And did you note that in your nursing notes?
Yes.
And why did you note that particular request?
Objection.
Oh, of course you. Sidebar. The reason we're sidebarring right now, you could see the look on my face. You could see the look on my face, right? Because what went through your head just then? What went through mine was you're in psychosis, but you then have the additional wherewithal while being in the hospital under some sort of sedation to call your lawyer. That's why they're sidebarring right now.
Yeah, counsel, go ahead.
Thank you. So on this particular night, the 2nd, she made a request of you for her lawyer, correct?
Yes.
Was that something she had asked you before?
No.
And so did you think it was something worth noting?
Yes.
Why would you note something like that?
Because that was the first time she referred to anything going on with the case. Or whatever.
Okay, and so you
What
had
in
you
the
had
hay
occasion
bale
after she
is
was
right.
extubated to have some casual conversation with her, correct?
Yes.
And this was not a conversation you'd had before?
No.
What did you do when she made that request? What was your response?
I sent what we call a consult to the social worker in order to coordinate reaching out to her lawyer.
Okay. In any of the shifts that you had been caring for this particular patient, did you see anyone besides medical staff and the law enforcement that were outside of the room come in and speak with her?
No.
Thank you. You guys see
Were you
me?
aware that she was not
Thank you.
to
Good
have
morning, Mel
visitors?
Hayes. Good to see you.
I was told the first night.
And is that something that you've seen before in your work as a nurse when there are police on site?
Yes.
Were you present at one point when some
You have to
troopers
hold it. Not yet.
came in to take photographs of her?
Yes.
Yeah.
And were you in the room when they took the photographs?
Yes.
Do you recall assisting them in viewing the injuries to her wrists and her neck?
I don't know if I don't remember assisting.
Okay, but you were present.
I was present, like in the room with her.
And fair to say, your contact ended with this patient on February 3rd when she was transferred off of the trauma
Megan on
surgical
YouTube,
ICU
thank
unit.
you.
Yes.
So, one moment.
Sure.
I'm in psychosis,
No, you
but
were
I've
not the only nurse to
but
treat
I've
her on the
I
night
have
shift, correct?
Correct.
So on days that you didn't
done
work,
all of
another
these
nurse
things,
treated
and
her.
I'm laying in the
And
hospital
were you
bed, and I'm
familiar
barely
with the
conscious.
nurse who was generally assigned to
Can
treat her
somebody
during
call
the
my
day?
lawyer?
Yes.
And who was that?
Megan Collins.
Megan Collins. And is it fair to say that with the law enforcement presence and this patient's particular situation, the amount of medical staff that were treating her on a regular basis was fairly limited?
Correct.
Meaning it was the same
Yes.
people all the time?
Mhm.
Okay, thank you.
All right. Attorney Reddington.
Morning.
Morning.
First of all, you have the certified copies of the records from Brigham and Women's Hospital.
Oh, snap. He's got 3 boxes of medical
Call any
records.
objection?
What are you doing?
I actually have those on a disc. I was going to put the disc in instead of all the paper.
Why don't we put both in?
Sure.
I'm like, yeah, those are usually on disc. He's got 5,000 pieces of paper.
We could do A and B.
41 A and B.
Thank you.
Why did he? Okay, let's talk about this for a second. For those of you who are physically like watching with me, what do you think just happened?
First.
Yes, I
Since
know
that was
what
the
just
last
happened.
that they asked
And
you
he
about.
knows what happened.
And correct me if
He
I'm wrong on
knows
any of these
that you
dates or
put that
facts.
on the disc. He knows, honey.
She was admitted on the
The
24th
reason he
of
didn't hand the
January. Is that
disc
correct?
over and he
Yes.
brought up,
And do you have a
I don't
memory as
know,
to approximately
5,000
what time
stacks
was it
of
in the
paper
evening?
is for
Well, she got to the ICU. It was around 3.
to make the jury
You're
feel,
very soft spoken.
Sorry.
to make them see and feel it instead of a
She
disc.
got to the
You know,
ICU
he knows
around
what he's
3
doing.
a.m.
Thank you. And she came by med flight?
She came to me from MRI.
And MRI obviously would be when you're taking the pictures.
Picture,
And that would be on the 24th of January in the early morning hours, correct?
I think it went into the 25th.
Into the 25th?
I think so.
Counsel asked you about the whiteboard that she would write on. And I think it was, again, if I'm wrong, correct me, was it January 28th that she used for the first time the whiteboard to communicate?
Yes.
And the whiteboard basically is just a whiteboard and,
Yeah.
and you write on it.
Erasable.
And she was not able to speak because she was intubated, right?
Yes.
And she was in the restraints that you've described as well, right?
Right.
Moving forward, January 28, 29, 30, into February 1st, February 2nd. It was on February 2nd that counsel asked you about her asking to reach out to her lawyer, correct?
Yes.
And do you know who her lawyer was at that time?
No.
Had you seen him before?
No.
Did you know, is his name Attorney Gelb?
No.
Make any reference to you?
No.
Do you know that whether or not she had conversation with Attorney Gelb regarding her status as being under arrest by the numerous police that were guarding the room?
I don't.
Do you know whether or not she was ever able to talk to Attorney Gelb, or did you refer her to the social worker people?
I put in a consult for the social worker.
Okay, thank you. When she was admitted on the 24th, would you agree that she was in the state of cardiac arrest shortly thereafter?
Shortly after arriving to me.
So I'm looking at the medical records that have been introduced for the jurors, and I'm referencing on page 18, if I may. Now, this is one page.
Thank you for
of
sharing, Doodle.
400 pages. of
1,200
medical
pages.
records.
That's
Can
what
you
it
see
was.
that? But, all right, here we go. Looking at this, does it indicate it's an SICU course?
Surgical ICU.
I'm sorry?
Surgical ICU.
Okay. And that makes reference to the fact that shortly after arriving
Yes.
in the ICU,
I
the
saw
patient
that,
had a
yes.
cardiac arrest. Is that there?
Yes.
It's very
Were
snarpy.
you there then?
I was.
And when it says the
Snarpalicious.
etiology of the arrest, she got 2 rounds of CPR before obtaining ROSC. Can you tell me, please, what is CPR at 2 rounds and what is ROSC?
Meaning we did chest compression. She was already intubated, so she was getting oxygen.
Okay. And then bilateral chest tubes were placed.
We are
in
on
her body?
my channel on
Yes.
YouTube
Does that mean
at
both
Steph's
sides?
Case
Both
Files.
sides.
Okay. And that punctures through the chest into what? The lungs?
The lungs.
Okay, the lungs. And when they placed the chest tubes, at this point, shortly after admission, there was 100 to 300 cc's of blood from each chest tube? What does that mean?
That's the output they got once they put the chest
Sorry,
tube.
again, just can you keep your voice?
That's the output they got once they put the chest tube in?
Okay. So when they put the chest tube in, it drained 100 to 300 cc's of blood. Is that correct?
Correct.
And then after that, again, shortly after admission to the hospital, coming from South Shore Hospital, she then got a massive transfusion protocol, which you told us about, right?
My sister is trying to call
What was
me,
that?
so I'm going to take this because this is unusual. I'll be right back.
We have a protocol that with blood, depending blood products,
Okay.
she gets infused rapidly.
And was there a notice shortly after arrival to the ICU, she was being turned and had 30 cc's of clear fluid that came out of her nose? Is that right?
Yes.
And what is that? Was there a suspicion that that was what's called CSF?
Yes.
And what is CSF?
It's spinal fluid.
Okay. Going to the next page, which would be 19, does it indicate, again, on there, if I can just bring this up a little bit better. So she now has noted acute blood loss, anemia, right? What does that mean?
She has a low blood count.
And do you know what happened to the blood or any idea?
I do not.
So she had very low, lost a lot of blood, right?
Yes.
And she had anemia. That would be what, low blood or something?
Yes.
And she required multiple transfusions immediately following her arrest, right?
Yes.
And when it says arrest, does that mean arrest by the police or does that mean the cardiac?
Cardiac.
I want to make sure that's clear. It's cardiac arrest, nothing to do with the police, okay? And she had required multiple transfusions. And you were there for that, correct?
Yes.
Were you aware of the extent of after you had the after you have the MRIs and the CAT scans, were you aware as the lead nurse or treating nurse as to what the extent of her injuries were?
At that point, I don't believe so.
At some point, did you become aware of that?
Yes.
Okay, so, and again, I've got the records, you don't, so let me do it this way, just to make it easy. Do you remember that she had a burst fracture of C1?
Yes.
What does that mean?
Means a cerebral fracture.
That'll be up here? So this is the cervical spine
Cervical.
up here?
Mm-hmm.
And then T5 and T6, there was a
Thoracic.
transection. What does that mean?
Thoracic.
Okay, so
On the
that'd be about
spine.
down here. And when it says transection, what does that mean?
It's severed.
And then T1, 2, 3, 4 also were injured as well, right?
Mm-hmm.
What is neurogenic shock? What does that mean? If you know.
Neurogenic shock.
Sorry, yeah, neurogenic shock. It just makes reference on.
These are not my notes, so I can't really.
That's fine. I understand. And this would be on page 65. Do you recall reviewing the documentation as to what's captioned present illness in the records? Did you know that she was presenting as a transfer from South Shore Hospital?
Yes.
Did you know that under present illness and the history would be that she's a 32-year-old female with history significant for postpartum depression? Did you know that?
Yes.
And did you know that after the fall with the C1 burst fracture and the complex transection of T5 and T6, she also had rib fracture, correct?
Yes.
On page 66, that would make reference to the time frame going into the 25th, on the 25th, that she was reacting to painful stimuli, right?
Yes.
And that basically means that she's not conscious, if you will, but she's able to react to.
If you cause pain.
Yeah. Okay. There's a notation of a contusion, laceration, and crushing of the thyroid with thyroidal edema. What does that mean?
She has swelling, I'm assuming, around her thyroid.
Okay. And that is.
Again, this is not my scope
Okay.
of practice. So.
Okay. On page 70, the same evening, making reference to the fact that in addition to the injuries to the spine, that she also had the rib fractures and was currently in shock. Do you remember that she was in shock? Yes, no?
Yes.
Okay. Would you agree, or do you recall that there's a notation that this patient is critically ill, and noting that she has postpartum psychosis?
Everything's fine. Now I got to take the dog out, and then I'll be right back.
I see counsel. Sorry. When you're treating a patient, one of the things you try to do is to know what their total body and emotional condition is, what they've been dealing with, and what injuries they have, right?
We get a rundown or history of the patient.
Sure. And as it goes into the end of January,
and she had been communicating on the whiteboard. You were aware at that point why she was in the hospital, right?
Yes.
You knew where she came from, South Shore Hospital, right?
Yes.
And you knew that
Lord a day,
there
honey.
had been discussion about postpartum psychosis. Isn't that right?
Yes.
Okay. And do you recall that, and this would be on, may I approach you under the witness?
You may.
Thank you.
You can maybe, if you could show counsel. Wait.
I want the date. and the
I'm
time,
back. Woo!
And the lawyer, legal team.
It feels amazing. It really feels
So this is
amazing.
One page from the medical record. Can you tell me in terms of what date is this page from?
125.
January 25.
If I'd ask you if you keep your voice, at least speak of that.
Oh, sorry. Yeah.
No, thank you.
January 25th,
Okay, does it say what time?
9 a.m., 9:03 a.m.
All right. Can I see
I
that?
can't believe we're still with this nurse. This is the
and
longest
looking at
time with
that-
the nurse.
Do you recall on that day,
They're not around the
you had
mics.
been working with her the night before?
If you can,
correct?
if their
Correct.
voices are lowered, they're
It
not on the
indicates
mics.
that, patient is under arrest, right?
Yes.
And there are police officers at her bedside. Right?
Outside the room,
Well, it says at her bedside on the record, doesn't it? I mean,
in the record, but I'm saying
and the night before,
they were outside her room.
outside the room. You were not there during the day, apparently, right?
Correct.
Okay.
Thank you, Dennis.
And there's a difference from you guys as far as your medical records. If the police officer is at the bedside as opposed to sitting in a chair in the hallway outside the room. Right?
Yes.
Okay. So indicating police officer at her bedside, we will
I
involve.
couldn't tell you on Sarah
and
Grace Patrick.
legal
I'm
teams, right?
dumbfounded
Yeah.
as to why that trial did not start today. So I'm gonna have to do some research when we're done here to figure out what has happened there.
And again, on page 72, there's a reference to CSF leak, and that's significant. It says significant amount of fluid coming from her nose. Do you have any memory of observing that in your treatment?
I did.
Okay. And then, of course, there was the code event that you've already described for us. There's the 100 to 300 cc's of blood coming from the tubes, and then it makes reference to, on page 74, to massive transfusion protocol. Is that like a medical term, or is that somebody
Yes,
describing it, or?
It's a medical, it's a protocol that we have at the hospital.
Okay. And on page 75, did you make reference to, or did you observe the injuries, for example, to her wrist?
I observed.
Yes. And would you agree with me, page 75 of the medical record, indicating if it says RUE, what does RUE mean? Do you know?
Oh, right upper extremity.
Right upper extremity, 3.5 centimeter deep laceration, volar aspect of wrist. Can you tell me what is the volar aspect of the wrist?
He's trying to prove severity right now.
I just don't know.
I'm not sure what
Okay,
that's
that's all right.
referring to.
That's fine. Would you agree that there was noted a 3.5 centimeter deep laceration on her wrist?
I can't say because I didn't measure. This is somebody else's note, so.
Well, when you looked at her, did you observe with your own eyes and your own experience that she had a deep laceration on the?
She had a laceration, yes.
You can't say it's deep or not?
I can't say. I didn't.
You want to say it was superficial?
I can't say that either.
So when you looked at the laceration on her wrist, you can't tell us if you would agree that it was a deep laceration.
I really didn't get to assess it at the time when she arrived. So.
LUE, underneath that, left upper extremity apparently, right?
Yes.
2 centimeter deep laceration, again on the volar.
They're not her
aspect of the
notes.
wrist. You did see laceration on her left wrist?
Yeah, she had dressings.
Okay. Um, And when she was admitted, she had the core temperature of 82 degrees. Is that correct?
If that's what's noted.
All right. Do you remember, did they use a bear claw or something like that? What is it they call it? They put
A bear hugger?
bear hugger. They put a bear hugger blanket on them. And when I say them, I mean people that have a low,
Low temperature to warm them up.
it hopefully raises the temp, right?
Temperature. Yeah.
And then if it has warm intravenous IVF, that would be putting warm saline in the body.
Yes, through an IV.
All right, all with an effort to try to get the temperature up, right?
Yeah.
Me too,
And her
Angela,
core
because they're
temperature was
just
82 degrees
medical
even
work.
after
I mean,
she
that's
was at
important. I'm not
South Shore
saying
Hospital
or just,
and
but
underneath
what I'm
the
saying
bear
in the
thing and all
scheme
that,
of
still,
That's what's noted.
Yeah.
Again, that's not my note.
talking
pretty
to
low,
them
isn't it?
bad
Yes.
and treating them badly and being kind of
Um,
smart with them, they don't deserve that.
and you made reference to pressors. I'm sorry, can you tell me?
Pressors, blood pressure medication to bring up the blood pressure.
Okay. On January 26th, she was still intubated, is that right?
Yes,
And she was under sedation, right?
yes,
And then you referenced January 28th overnight shift, she was still intubated, right?
yes,
And January 28th is when she first started utilizing the whiteboard, is that correct?
yes,
But she was intubated, yes?
yes,
She was restrained to the bed,
yes,
and had the tube was still in her mouth, and she was writing on a whiteboard on the 28th of January, correct?
she was able to, yes,
January
I agree,
30th, she
Sarah.
was extubated, as the district attorney asked you, right?
yes,
So,
Cause and effect,
at
Sarah,
that
cause and
point,
effect.
was she able to talk, talk?
talk,
Okay. And then on February 2nd is when she used she asked about wanting to reach out to her attorney. Is that correct?
yes,
But you had no knowledge as to her mother and father getting an attorney for her while she was in custody with the police all around her?
no,
Okay. And you tried to help her out as best you could?
yeah,
right?
to coordinate. It's harder at night to,
Sure.
so I wanted to pass it on.
And finally, she was not able to have visitors per order of the police. Is that correct?
Correct.
Thank you very much, ma'am.
Thank you.
I think they'll break for lunch now. Oh,
Ms.
redirect.
Amity, the
Then
first time that Ms. Clancey, the defendant, the patient, used a whiteboard with you was on January 28th, correct?
Yes,
You're not aware of if she used that tool with other nurses on other shifts,
No.
were you?
no,
And the first time that she mentioned a lawyer on the February 2nd, that's the first time she mentioned a lawyer to you, correct?
correct.
You were asked about the trauma in the chest tube and that she lost 100 to 300 cc's of blood.
Yes,
The transfusion came after that, correct?
yes,
And fair to say the course of her treatment coming to Brigham was that she first came in through the emergency department, correct?
yes,
Then she was sent for an MRI,
yes,
and then she came to the trauma surgery, correct?
yes,
And you're aware that she had other imaging like CT scans, correct?
yes,
And that especially when it came to the head CTs, she didn't have any intracranial injuries or anything that required that you be focused on her head injury, correct?
correct.
So it was more a cardiac issue and keeping her stable and internal bleeding in the chest area.
Yes,
As far as what you're aware of from other treating physicians, you're aware Dr. Anderson was one of the trauma surgeons that was treating the patient,
yes,
and he was making assessments and giving orders to you and other nurses, fair to say?
yes,
And are you aware that he identified in the history that this patient actually had a history of postpartum mood symptoms, not psychosis?
I would have to look at the note. I don't remember.
Those aren't notes that you would have written.
No,
And you weren't taking a full history of the patient?
not at the time. No,
Were you aware that she then subsequently was fully evaluated by the psychiatric team?
I knew she saw psych, yes.
And were you aware that they ultimately identified that there's an inherent uncertainty in her diagnosis?
I do not remember.
As far as the lacerations went, in your treatment of her, again, you treated her overnight shifts for various days, correct?
Yes.
Did you ever have a situation where you had to change her bandages because they were seeping?
No,
And are you aware that
except for the first night, but we didn't get to that because she coded.
because she coded.
Yeah.
And then you're aware that the next day after, another individual, a physician's assistant, actually came in and treated those lacerations.
Sutured, yeah.
And
Is it me, or have they
as
done
far as Dr. Anderson
a
goes, were
long
you aware
time
that
with
on
this
January
nurse,
25th,
even
he
longer than
noted
the
that
doctors?
the lacerations to her neck and wrists were very superficial and didn't require treatment at that time?
I was not aware.
Is
I
it-
don't remember that note.
Would you,
Does this seem long to y'all?
if I showed you the record that's in his note, would you
Yeah.
agree that that's an assessment that he made?
Yes.
Okay. And he didn't instruct you to do anything further with those injuries?
Yes, right.
Thank you.
Just very briefly. Sure. District Attorney asked you about the evaluation by the as she put it, psychiatric
cross.
teams with a determination that there was inherent uncertainty according to the psychiatric teams. Do you know when the psychiatric teams were evaluating her?
I don't know. It was after, during the day. I don't know what day, but
But in any event, I did show you on the thing over there, where the reference was made to postpartum depression, postpartum psychosis, correct?
yes.
And
Thank you, Angela.
that's all I have. Thank you, ma'am.
Anything further?
Nothing.
All right, thank you, ma'am. Let me sit down. Thank you. All right, come up.
The Commonwealth would call Megan Collins.
All right. This is going to conclude my coverage for the day on this trial. You are free to, they're calling in another witness, but you are free to continue to watch it on Court TV on YouTube. They are the ones that are streaming it. The next time I'm going to be live is in the morning around 10:30 a.m. We'll pick up on this case. We'll talk about it. We'll go through like what we're doing now. And I will try to find out in the meantime what in the hay bale has happened in the Sarah Grace Patrick trial and get y'all updated. We're supposed to start streaming on Wednesday, I guess, and now that's off. I don't know what's going on with that or what has happened. I'll probably do a video on it, so make sure you're following me if you're not, so that you'll see the video, hopefully,
Thank
when
you.
I update you on what has gone
Good
on.
afternoon.
I want to thank you for
Can you
joining
please
me
tell the jury
today.
your first and last name?
Megan Collins.
Would you mind spelling your first name for the record?
My phone just died.
McChan. Collins.
Is anybody on YouTube still on
Thank you.
TikTok?
And what do you do
Because
for
my
work?
phone just
I'm an
died.
ICU nurse.
And
how
I
long have
wanted
been a
you to
nurse?
tell everybody
11
for me.
years.
And did you
Because
go
I
to
know
school for that?
TikTok is still
Yes.
running.
Where'd you go?
Hold on, I can get in
Sacred
with
Heart.
my other phone.
What hospital
on
do you
just a
currently
minute.
work at?
Brigham and Women's.
And how long have you worked there?
I figured it was about to die. I was
In
like,
January
Lord.
freaking love New York. What unit were you working on at the Brigham?
The trauma surgical ICU.
Did you work a
Sorry,
particular
my
shift?
phone died.
I did.
My
And
phone
what
died
shift
as I was
that?
leaving. But what I was
7
going to
a
say
to 7
was,
p.
thank you for
So,
joining
7
me
a.m. to
today.
7
I
p.m.
really appreciate you and your time.
And you just have to
It
answer
means
out
more
loud,
to me
sorry.
than you will ever
Okay.
know.
Yes.
Join me at
I'm going to draw your
10:30 a.m.
attention
in the
to a
morning.
particular
Thank you
patient
for
that was treated
everything.
there beginning on
Okay.
January 24th.
Make sure you
Lindsay
follow me on
Clancey. Are
every
you
social
familiar
media
with that
platform.
patient?
All you have to do is look for the
Were
same
you a
username and
nurse that was
logo.
treating her during that
I
day
love
shift
you.
while she was
The
in
most
the
important
ICU?
thing for me
I
today
was.
is that you be
Are
kind
you
to one
aware that
another.
she arrived at
Because
the
it's
Brigham
free.
Hospital on January 24th
I love you, Treat Taylor.
of 2023?
When she was
Okay,
admitted
we done
to
it.
our ICU,
Thank you,
it was
YouTube.
overnight.
We continue
So as far
coverage
as
tomorrow.
the hospital, do you
See
know when
then.
she arrived at the hospital?
I believe the day evening